I welcome all to another session of Stroke Support India. And I'm very happy to have with us Sonal Chitnis, who's also an active member of our support group and our various activities. So we'll be talking about improving speech intelligibility and verbal praxis post-stroke today. And just a short introduction to Sonalji. She's quite well known in speech and neuro speech circles. She is an associate professor at Bharati Vidyapeeth School of Audiology. Has a long association with various bodies, including Aphasia Stroke Association of India, Neuro SLP Task Force of Indian Federation of Neurorehabilitation, IAN and ISHA Clinical Aphasiology of ISHA. And today she'll be talking about post-stroke speech and language disorders, particularly Dysarthria. I look forward to also learning in this session. And of course, Apraxia and related rehabilitation. Shruti will be taking over the coordinating the session. I will be there in the background, and then we'll be joining in later again. So thank you very much. Over to you, Shruti and Sonal ji.
Yeah, welcome, Sonal ji. It's a pleasure to have you in here for our sessions today, particularly for our persons with aphasia, to help them understand what is dysarthria and what is apraxia. Because usually what we go through in our groups is every participant or every new member who is joining, whom I talk to personally. So every member who is joining our Telegram group, I talk to them personally. I tell them, please go through an assessment so that you'll know whether you also have an apraxia or a dysarthria. Otherwise, they will tell, I'll ask my physiotherapist to help me with speech therapy. The persons with left-sided hemiplegia, which I often say that, please don't do that. Please go to a speech therapist, and nobody else can take that place. Because when other therapists can't play a role of a physiotherapist, so we can't expect, everybody to become a speech therapist. So please go to them, learn the technicalities of aphasia and stroke. So, and I have a lot of questions lined up. So after your session, when others ask, I'll be asking my questions. Thank you so much. Welcome. I'm looking forward to learning with you today.
Okay. So good evening, everyone. I'm Sonal Chitnis. I'm a neuro speech language pathologist, Vacha Bhasha Tadnya. I'm going to talk certain things in English and मैं कुछ चीजें हिंदी में बोलूंगी. So सबको समझ में आएगी. मैं बहुत ज्यादा जार्गन टेक्निकलिटी नहीं बात करने वाली. मैं बताने वाली हूँ कि एक्सरसाइजेस करने के लिए पहले हमें चाहिए समझना कि क्या दिक्कत है बोलने में. So we should first know that is someone post stroke able to speak clearly, and speaking is lot complex. Communicating is very important. So you communicate with gestures, and you say हाँ ना आजा, अभी भूख नहीं है, चाहिए नहीं चाहिए, अच्छा मुझे बताओ कि अभी बिल कितना हुआ. These are all communication needs of everyday living. And post stroke, you have lot to communicate to the family, your friends, your society, your colleagues you work with. It depends on everyone. So stroke, लकवा, पक्षाघात, हर एक पेशेंट, मरीज, रुग्ण, मैं बोलूंगी व्यक्ति, क्योंकि first he or she is a person who has all right to get better, back to the work, if it is student, back to the school, if it is a homemaker, a mother of children, wife of a husband, caretaker of someone, daughter of someone. So you have plenty of different roles to play. So you have to go back to the society as a person, as a citizen. not everyone is lucky enough to get all the help in all the time and complete recovery. And in India, rehabilitation has taken a backstage in majority of places in towns and rural places because of poor rehabilitation professionals, manpower needed. Many patients cannot afford, they can't easily go or travel or commute to the rehabilitation professionals. Cities do have same constraint. हर सिटी में, हर शहर में अच्छे अच्छे अस्पताल में अच्छे अच्छे डॉक्टर्स होते हैं, अच्छे अच्छे थेरेपिस्ट होते हैं, not necessary.
I think we are losing you in between, Sonal ji. His voice and video is getting interrupted.
Am I audible now?
You are audible, but I think there is a bandwidth issue perhaps. If I don't know, are you on your mobile?
No, on my laptop.
Okay, so let's see. Let's proceed. I hope it will improve. Yeah, please carry on.
Just a minute.
Yeah, okay.
I hope this should resolve and get a better connectivity. Am I audible now?
Yes, you are at the moment. You are. Let's take it
Great.
further. Yeah.
So, respiratory support, weakness of phonatory system, weakness of resonatory system, that may lead to difficulty in speaking. So you have one thing, aphasia, which is a language disorder, and cognitive linguistic in terms of understanding, speaking, reading, writing requires your thinking, your thought process, your importantly thought formulation from word to phrase to sentence. Dysarthria is sluggish speech, slurred speech, which one can think of saying this in a very layman term. तो मैं बताने वाली आपको कि जब किसी को लकवा, फालिज या पक्षाघात होता है, तब अगर फेस, चेहरे की मस्तिष्क से स्ट्रोक होने से अगर मस्तिष्क से आने वाली नसों से जो स्नायु वीक हो जाता है, अशक्त हो जाता है, तो उससे बोलने की दिक्कत आती है. सो जहां पर आपके फेस और श्वसन संस्था, सांस लेने की संस्था या फिर बोलना, आवाज गाना, इसकी संस्था की स्नायु अगर अशक्त हो जाते हैं, तब शायद व्यक्ति को बोलने में दिक्कत आती है. सो कभी कभी बिल्कुल समझ में नहीं आता है, कभी कभी पता है, समझ में आता है, लेकिन शब्द नहीं आते हैं, लिखने में कठिनाई होती है, पढ़ने में कठिनाई होती है. ये अफेजिया हो सकता है और सब समझ में आ रहा है, बोल भी सकते हैं, लेकिन क्लियरली बात नहीं कर पा रहे हैं, या फिर साफ बात नहीं करने आ रही है, स्पष्ट उच्चार नहीं आ रहे हैं. ये जब लगता है उसे डिजार्थ्रिया बोलते हैं. सो इन अ कॉमन लेमन टर्म पीपल से द स्पीच इज स्लगिश. साफ नहीं है बात. कभी कभी हो सकता है कि जबान जैसे आधा अंग ढीला पड़ जाता है, वैसे आधी जीभ भी ढीली पड़ सकती है. या फिर मुंह से लाल टपकती है, और उससे लाल से क्या होता है कि आदमी ठीक से बात नहीं कर पाता है. यही चीजें अन्न चबाने के लिए या फिर पानी अच्छे से अंदर लेने के लिए, निवाला खाने के लिए भी दिक्कत आ सकती है, समस्या हो सकती है जब वहां पे अशक्त है, आपकी स्नायु है. सो व्हाट इज वीकनेस? एनी सॉर्ट ऑफ वीकनेस इन लिप मसल्स, tongue muscles, your palate muscles, your importantly your phonatory system. So neck, pharyngeal muscles, velum मतलब palate, जहां पर आपको बोलना है प, लेकिन नाक से हवा आ रही है और मरीज बोलता है खाना चाहिए, और पूरी हवा, काफी कभी इवन खाना या पानी भी नाक से आ सकता है. सो ये मस्कुलेचर वीकनेस, स्नायु की वीकनेस, उसके वजह से भी बात करनी समस्या हो सकती है. सो इसे डिजार्थिया बोल सकते हैं. सो यहाँ पे जो पेशेंट्स है उनमें से कोई मुझे बोल सकता है कि हाँ ये दिक्कत मुझे शायद हुई थी पहले, या फिर यहाँ पे कोई है केयर गिवर, मरीज के साथ में होने वाले, रुकने के साथ में आने वाले, जहाँ पे उनके घर वालों को कुछ दिक्कत हुई थी, जो मुझे बोल सकता है कि हाँ मेरे पेशेंट को स्ट्रोक आने के बाद में स्पष्ट उच्चार नहीं आते थे, लेकिन अभी शायद आ रहे होंगे, या फिर अभी भी बात करने में दिक्कत है. कोई है ऐसा? मुझे कोई बोलेगा कि उन्हें क्या अनुभव हुआ था, उन्हें क्या दिक्कत आई थी? Let me tell you, I want this session to be interactive. So I would like to help you understand dysarthria, aphasia, and yeah, later apraxia. मैं कोशिश करूंगी यहाँ पे व्यक्ति से बात करने की, उनसे जुड़ने की, उनके घर वालों की क्या समस्या है वो समझ में आने की, और उस हिसाब से हम क्या एक्सरसाइज कर सकते हैं. मैं कोशिश कर रही हूँ कि आपको थोड़ी सी बेसिक एक्सरसाइज जानकारी दो पहले, और फिर एक्सरसाइज बताऊं. कोई है जो मुझे वॉलंटरली बताएगा कि हाँ
आई
ये
थिंक
स्पष्ट
मोनिका जी
बात
ने
नहीं कर
हाथ
पा रहे थे?
हाथ रेस किया था. मोनिका जी ने शी वांटेड टू से समथिंग. और
बोलिए.
अगर और कोई है जिनको ऐसी प्रॉब्लम हो, प्लीज फ्री फ्री टू अनम्यूट योरसेल्फ. आप अनम्यूट करके बाद में बोल सकते हैं. मोनिका जी आप बताइए.
हेलो.
हाँ जी
हेलो
मोनिका जी,
मोनिका
वी
जी
कैन
बोलिए.
हियर.
हाँ. सो एक मिनट. हाँ. माय दिस इज फॉर अबाउट माय मदर. उनको स्ट्रोक हुआ था. तो शी हैज अ स्पीच प्रॉब्लम. कोई कोई शब्द उसके बहुत क्लियरली आ जाते हैं, लेकिन कोई कोई आप जैसा बोल रहे हैं थोड़ा स्लरी आ जाता है. एंड शी हैज दैट प्रॉब्लम विद लाइक फूड व्हेन शी इज ईटिंग फूड एंड ऑल ऑफ दैट. एक
ड्रूलिंग,
साइड
इज
से
देयर एनी ड्रूलिंग ऑफ सलाइवा?
या ड्रूलिंग
लार
थोड़ा
आ
सा
जाती है?
खाना खाते वक्त होता है. ऐसा कभी कभी होता है, ऐसा हमेशा होता है ऐसी बात नहीं है, लेकिन समटाइम्स शी डज हैव दैट प्रॉब्लम. तो हम लोग उसको अभी
कितने
स्पीच
साल हुआ है
करवा रहे
स्ट्रोक आकर?
हैं. सितंबर में आया था लास्ट ईयर.
और जैसे स्ट्रोक आने के बाद में हर एक दिन बहुत कीमती होता है. सो जैसे दवाइयाँ या मेडिकल इंटरवेंशन जरूरत है, वैसे ही स्पीच थेरेपी भी. जब भी मरीज न्यूरोलॉजिकली स्टेबल है, आईसीयू में से ही अगर स्पीच थेरेपी आपको मिलती है, तो खाने की समस्या, निगलने की समस्या, बोलना, कम्युनिकेशन की थेरेपी अगर शुरू करते हैं तो काफी हेल्प होती है. सो स्टेप बाय स्टेप, एवरी डे पेशेंट improves, every day, every week, every month someone makes an improvement. And there are patients where if they develop hypertension attack, seizure, or stroke, epilepsy, or a recurrent stroke, one more stroke, then it can happen that whatever the achievement has, improvement has come, that also can get completely down, or it can get regressed, और पहले जैसे थे वैसे कि वापस हो सकता है. तो क्या इम्पोर्टेंट है समझना? पेशेंट जो बोल नहीं पाता है, उसे पहले असेसमेंट मिलनी चाहिए. मतलब उसकी जानकारी क्यों बात नहीं कर पा रहे हैं, क्या हो रहा है, दिक्कत क्या है, उसकी जांच होनी चाहिए। सो अगर आपको पेशेंट को पहले पूछना है नाम क्या है आपका, आपको दिक्कत क्या हो रही है, और सिंपल क्वेश्चंस स्पॉन्टेनियसली कैसे बात कर पाते हैं वो देखना है। सो अगर वर्बल फ्लुएंसी कितना फ्लुएंटली बोल पाते हैं वो हम जान जाएंगे। अगर आप पेशेंट को 3 से 4 सिंपल क्वेश्चन पूछो, उन्हें पूछो आपका पूरा नाम बताओ, तो अगर पेशेंट बोल रहा है कि वाह 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 वाह, तो आप बोलोगे अरे मेरी मम्मी या मेरे पापा या ये पहले तो ऐसे नहीं बात करते थे, तो शायद बोल शब्द भी क्लियर नहीं आ रहे हैं। या फिर कोई बोलेगा मोनिका आवी, तो इसका मतलब है यस समझ में थोड़ा आ रहा है, बात कर रहे हैं लेकिन क्लियर नहीं है। इसे भी बोलते हैं डिजार्थ्रिया, स्लगिश स्पीच। कुछ पेशेंट्स को अफेजिया मतलब समझने में, बोलने में, शब्द चयन करने में भी दिक्कत होती है, और मस्कुलर वीकनेस होता है, मतलब बोलना साफ नहीं आता है, लिप मतलब होंठ या टंग, ये मस्कुलेचर भी वीक होता है, अशक्तपना होता है, तो उसके वजह से भी बात करने में दिक्कत होती है। और मैंने जैसे कहा लाल टपकती है, लाल बाहर आती है, एक मतलब वन साइड विल बी डेविएटेड वीक, तो एक साइड झुक जाती है, यहाँ पर ग्रुप हो जाती है। तो अगर लेफ्ट स्ट्रोक है, जो आपका बोलने वाला ब्रेन, मैंने लास्ट टाइम आपको कहा था लास्ट लेक्चर में, लेफ्ट साइडेड स्ट्रोक विल गिव द राइट वीकनेस, एंड आपका लेफ्ट ब्रेन बात करने के लिए, लिखने के लिए, पढ़ने के लिए बहुत ही इंपॉर्टेंट होता है, क्योंकि दैट इज अ स्पीच ओरिएंटेड डोमिनेंट ब्रेन। आपकी बातें राइट में भी होती है, लेकिन फिर भी अगर राइट ब्रेन में स्ट्रोक आ गया तो लेफ्ट साइड वीकनेस आती है। उन्हें अफेजिया होने के चांसेस 20 से 30% होते हैं। ऐसे नहीं कि उनको बोलने में बहुत अच्छी सरलता होती है और फिर बिल्कुल दिक्कत नहीं होती है, लेकिन स्पष्ट बोलना और कभी कभी नहीं देख सकते हैं, नहीं समझ सकते हैं, ये हो सकता है राइट ब्रेन के स्ट्रोक में। और हम समझेंगे कि अफेजिया वर्सेस डिजार्थ्रिया, शब्द चयन करना, उसे क्या बोलना था, वो नहीं आ रहा है मुझे, वो एम्प्टी स्पीच, मतलब हमें बिल्कुल शब्द चयन नहीं करने आना है। कभी कभी पेशेंट को समझ में भी नहीं आता है, ना वो समझ पाते हैं, ना वो पॉइंट कर पाते हैं, ना वो देख पाते हैं, ना वो बोल पाते हैं। और पढ़ना, लिखना, कैलकुलेट, काउंट करना, ये भी बहुत वीक इम्पेयर हो सकता है। So what is important? Yeah, I will try to say in English also. Post stroke, there are person with stroke may have difficulty in understanding that they can't even point, they can't even say with gesture that what they want, what you're asking. Someone may not get correct words. So every person with stroke could have a different clinical picture. हर एक stroke patient कहाँ पे stroke आया है, उस हिसाब से ब्रेन कैसे खुद इम्प्रूव हो रहा है, थेरेपी से और बिना थेरेपी से। लेकिन हम जब किसी से बात करते हैं, हम किसी को बोलते हैं कि आप कोशिश करो बोलने की, वो स्टिमुलेशन भी बहुत इंपॉर्टेंट होता है। सो इट इज इम्पॉर्टेंट दैट what are the troubles with speech. So in order to understand that intelligibility is speaking clearly, how fluently I'm able to speak at word level, phrase level, sentence level. And when we converse, we just don't say in sentences, we use longer and longer sentences, we have a monologues, we use dialogues, and that holding a conversation is very important. When you have known more than one language or two languages, so you need to have proficiency in your mother tongue, English or Marathi or Hindi, or equal if you are using Hindi English, Gujarati, Marathi and English, Gujarati and Hindi, Punjabi and Hindi, Punjabi, Hindi and English. So use of words, per, पानी, मुझे पानी चाहिए, मुझे अभी ठंडा पानी चाहिए. So formulating word, coining a word coining a phrase, formulating a sentence. शब्द चयन करना, फिर शब्द सरल से, सहज से, स्पष्ट से बोलना, लंबे सेंटेंस, लंबे वाक्य बोलना, ये जरूरतें होती है रोजमर्रा की कम्युनिकेशन की, संभाषण की, बोलने की. सो वाचा इज स्पीच, भाषा इज योर लैंग्वेज. सो वाचा माने आपकी वाणी सरल, सहज और स्पष्ट होनी चाहिए. You need to understand that whenever we speak, it has to be clear. So what can happen when someone gets a stroke? You can either see the person can have a hot potato, as if something hot someone is gobbling in the mouth. कुछ गरम चीज आपने जल्दी में खा ली तो कैसे आपकी बात आती है, या फिर बहुत ठंडी चीज आपने मुंह में ले ली और आप जीभ आपकी ठीक से नहीं अगर घूम रही है और बात कर पा रही है, तो वैसे हो सकता है. So moving your tongue proficiently, efficiently, speaking correctly, moving your lips, moving your palate. But speech is beyond that, you know. Speech requires a good adequate breath support. So जब भी stroke होता है, so 30 to 40% of people may have trouble in even respiratory support, efficient production of speech because of the fatigue. और इसके वजह से मरीज जल्दी बात नहीं कर पाता, शायद वो थक जाता है जल्दी बोलने में. सो आपको बोलने के साथ में व्यक्ति के साथ में रेस्पिरेटरी सपोर्ट भी इंप्रूव करने की जरूरत होती है. स्पीच इज अ कंबाइंड एफर्ट ऑफ रेस्पिरेटरी सिस्टम, फोनेटरी सिस्टम, स्पीकिंग, आर्टिकुलेटरी सिस्टम एंड द कंट्रोल कम्स फ्रॉम योर ब्रेन. कहाँ पे स्ट्रोक ये भी बहुत इंपॉर्टेंट होता है. One has to understand that where is the stroke? Is it छोटा brain, small brain, cerebellum? So for people who are layman here, common man doesn't understand the technicalities of the brain. But I would tell you the small brain and the large brain. So you have a cerebellum, which is a coordinating brain, which is a important brain for your coordination of muscle activity. छोटे ब्रेन सेरिबेलम में अगर स्ट्रोक आता है तो बातें कोई पी कर आया, जैसे ड्रंकन आदमी होता है, someone has drunk and come, that kind of speech can be sounded. और हम घसर जाते हैं, you might feel that you're slipping, the words are slippery, the speech is sluggish, one can have a drunken speech post stroke. So I'm trying to simulate, मैं आपको दिखा रही हूँ कि क्या हो सकता है. और इसके लिए आपको पता होना चाहिए कि स्पीच पैथोलॉजिस्ट, स्पीच थेरेपी जो एडल्ट रिहेबिलिटेशन न्यूरोलॉजिकल केयर में ट्रेन हो, उनसे आपको हेल्प हो सकता है. तो क्या करना है पहले कि स्ट्रोक आने पर बात आ रही है, बात करने में कुछ दिक्कत है या नहीं, ये बताना जरूरी है. हर एक डॉक्टर, जनरल फिजिशियन, जनरल सर्जन अवेयर नहीं हो सकता है स्पीच थेरेपी के बारे में, या फिर उन्हें पता है लेकिन उन्हें पता नहीं कि इस मरीज को स्पीच थेरेपी की जरूरत है. सो आप जहाँ पे आपके घर वाले बात नहीं कर पा रहे, जैसे वो हाथ नहीं उठा पा रहे तो आप बोलते हैं ना क्यों नहीं हाथ उठ रहा है, क्यों नहीं चल पा रहे हैं, वैसे ही आपको करना है. अगर वो क्यों नहीं बात कर पा रहे, हस्बैंड हो, वाइफ हो, बच्चा हो, स्ट्रोक बच्चे में भी आ सकता है. वी गेट टू सी पीडियाट्रिक स्ट्रोक ऑल्सो. सो कोई भी व्यक्ति जिसे स्ट्रोक आता है, आपको पता है क्या स्ट्रोक होता है. और जब दिमाग में धमनियां, दिमाग में पाइपलाइन जो आपको रक्त पुरौठा करती है, वो नहीं अगर ठीक से वहां पर फंक्शन कर पा रहे, तो उस हिसाब से चलना, बोलना, समझना या फिर निगलना या फिर ये सभी चीजें एक ही व्यक्ति में सरलता से नहीं आ सकती है. सो जस्ट बोल नहीं पा रहे हैं, अगर ये समस्या है तो आप लाइटली नहीं लेना चाहिए, आपको सीरियसली लेना चाहिए कि हाँ इसे कुछ चीजें हैं, इसे कुछ दवाइयां है. तो मैं बोलूं नहीं, स्पीच, लैंग्वेज, समझना, चलना, ये फंक्शंस है, ये बिहेवियर है, और इसके लिए आपको एक्सरसाइज करनी पड़ती है. सो देयर इज नो सब्स्टिट्यूट विथ मेडिकेशन अलोन. स्ट्रोक के लिए इंटरवेंशन इंपॉर्टेंट है फर्स्ट, उसके बाद में आपको स्पीच थेरेपी भी करवानी है, फिजियोथेरेपी भी करवानी पड़ती है अगर कुछ हद तक मरीज बोल नहीं पाता है। मैं देखती हूँ सर साहब, बहुत सारे मरीजों को अगर बात करने आती है लेकिन थोड़ी सी दिक्कत होती है तो पेशेंट को स्पीच थेरेपी रेफर नहीं मिलता है। लेकिन वही थोड़ी सी बात करने नहीं आ रही है, वो भी किसी के लिए बहुत दिक्कत समस्याकारक हो सकती है। अगर वो टीचर है, अगर वो डॉक्टर है, अगर वो इंजीनियर है, अगर वो अकाउंटेंट है, अगर वो सेल्स मैनेजर है, तो बात करने पर ही उनकी पूरी काम और ऑक्यूपेशनल नीड्स उन पर निर्भर करता है। सो इसीलिए बातें करना, स्पष्ट सा बातें करना, सहज से बातें करना बहुत इंपॉर्टेंट है। सो मैं जानते हैं पहले कि स्पीच क्या होता है। सो मैंने कहा आपको स्पीच मतलब वाचा, वाणी, और आपको कि बात करने में क्या दिक्कत है तो आप क्या कर सकते हो, मरीज से पूछ सकते हो नाम बताओ, आपका पता बताओ, 1 से लेकर 10 तक गिनती करो। सो यू कैन आस्क कंप्लीट नेम, address. You can ask the person to count 1 to 10 and try your best to ask the person to count from backward 10, 9, 8. That will also help you get the person's attention, executive function, calculative ability, and that has an impact post stroke that someone may not be able to get backward counting. जरूरत है backward counting रोजमर्रे की जिंदगी में? मैं बोलूं नहीं, लेकिन अगर हम 5 से 1 तक, 10 से 1 तक उल्टी गिनती नहीं कर पाते, उसका मतलब है कहीं पे तो कुछ तो गलतियां हो रही है कि मरीज को कठिनाई हो रही है गिनती करने में। सो one can understand that speech clarity is one thing, getting correct words another thing, able to remember, able to attend correctly and get counting backward and forward, letters, numbers, sequencing. This is something called cognitive task. ये आकलन क्षमता और उससे ही ज्यादा इम्पोर्टेंट है। और ये क्यों इम्पोर्टेंट है? क्योंकि रोज समझने के लिए, पढ़ने के लिए, काम करने के लिए आपको समझना पड़ता है, याद करना पड़ता है। So one has to think, one has to reason out, one has to execute rightly. So this could be also important task to the patient you are trying to help, your own person or the person you are known and you have gone to pay a visit. You should be able to try to assess. What if you can ask the person to check whether the person can actually speak clearly or not, get correct words or not? A simple task is show some flashcards, show some objects. ये क्या है? मोबाइल। ये क्या है? कंघी। और सिंपल चीजें आप उनको बताओ और उनकी नाम पूछो और फिर आप बोल सकते हो। आप एक कोई वाक्य बना सकते हैं इस चीज को लेकर। सो कैन यू मेक अ सेंटेंस? So this is sentence formulation task can be also helpful in making you understand how are the speech abilities at word level to sentence level. So is it clarity which is not there, or patient is not able to get correct words? Sometimes both can co-occur. ना साफ बोल सकते हैं, ना सरल बड़े वाक्य में बोल सकते हैं। सो ये भी आपको उतनी ही जरूरी है कि क्या दिक्कत है। और कभी कभी बोलना चाहते हैं कुछ और कुछ और ही आता है। जैसे मैं आपको बोलूं नाम क्या है आपका, तो मैं बोलूं आओ, ओ, अना, ओ, सो, असन, ओ, नल, तो इससे ग्रोपिंग बोलते हैं। सो अगर आप सो, Sonal, it's my name, Sonal. I should be able to say it clearly, fluently and clearly. But many times patient may not be able to get it correctly, the sound. So vowel, consonant, coining to make a sound, then word, the phrase. So मैं सोनल हूँ, मैं सोनल चिटनिस स्पीच लैंग्वेज पैथोलॉजिस्ट हूँ, जो यहाँ आपको सरल सहज शब्द में डिजाथ्रिया, अप्रैक्सिया, स्पीच इंटेलिजिबिलिटी, कैसे हम अच्छे से बात कर सकते हैं, स्ट्रोक की वजह से क्या हो सकता है और कैसे आप उसको हेल्प मिल सकती है, ये बताने के लिए कोशिश कर रही हूँ। सो I and what is my agenda for this talk. मैं आपको कोशिश कर रही हूँ बोलने के लिए, लेकिन स्ट्रोक होने के बाद में काफी सारे मरीज खुद से जो उन्हें बोलना होता है वो सिंपल सीधे शब्द में, वाक्य में बोल नहीं पाते। तो अगर जस्ट स्पष्ट बोलना नहीं आ रहा है तो उसे डिजार्थ्रिया बोलते हैं। और डिजार्थ्रिया के अलग अलग टाइप्स होते हैं, अलग अलग प्रकार होते हैं। सो वन कैन हैव अ स्पास्टिक डिजार्थ्रिया, मैंने कहा ना हॉट पोटैटो स्पीच, और कभी कभी स्ट्रेन्ड और स्ट्रैंगुलेटेड स्पीच आता है कि आई वांट टू, तो ऐसा लगता है कि मरीज को बिल्कुल बात करनी नहीं आ रही है कि क्यों ऐसे हो रहा है। तो मैं आपको बता रही हूँ, जब स्ट्रोक आता है तब कॉर्टेक्स, आपका मस्तिष्क, ब्रेन जो है सीईओ ऑफ योर थिंकिंग, रीजनिंग, डूइंग टास्क, फ्रंटल लोब, temporal lobe, parietal lobe, these are very important. They have a very important role in your speech and language. ये मस्तिष्क के जो भाग है अलग अलग लोब्स, अलग अलग तरीके से कटिल जटिल पाथवेज में, सर्क्यूटरीज में जुड़े हैं। और किसी का काम है समझना, किसी का काम है बोलना, किसी ब्रेन के पुर्जे का काम है शब्द याद करके आपको बताना, किसी ब्रेन के पुर्जे का काम है आपको क्लियरली और अच्छे से कोऑर्डिनेटेड वे में बात करने के लिए हेल्प करना। सो जहां की ब्लड सप्लाई अगर धीमी हो गई है, कम हो गई है या फिर बिल्कुल नहीं है, उस हिसाब से उसकी सिम्टम्स, उसकी समस्याएं दिखाई देती है। सो किसी को स्पास्टिक स्पीच होता है, ऐसे मैंने अभी बताया। किसी को होता है फ्लासिड डिजार्थ्रिया। फ्लासिड मतलब लो मोटर न्यूरॉन। अगर लो मोटर न्यूरॉन क्या होता है? आपके क्रैनियल नर्व्स, सो आपकी जीभ, आपकी मसल्स, हर एक लिप्स, टंग, ये बकल कैविटी, हर एक स्नायु को नर्व्स, नसें आपकी वो सप्लाई करती है। और वो सप्लाई, वो नसें जुड़ जाती है और उनका सप्लाई जो मेन कंट्रोल से आता है वो ब्रेन, वहां पर अगर ब्लड सप्लाई कम हो गया तो उस हिसाब से भी लोगों को बोलने में दिक्कत हो सकती है। और वो जस्ट क्रैनियल नर्व, अगर लो मोटर पाथवे अगर डैमेज हो सकता है या ब्रेन स्टेम स्ट्रोक हो सकता है, तब जाकर पेशेंट समझ पाता है अच्छे से, काफी हद तक बोल भी पाता है, लेकिन वो बिल्कुल क्लियरली नहीं होता है। कोई नाक से बात आती है, नेजल ट्वैंग बोल कॉमन टर्म में। सो मुझे बोलना है आपको कि आप कैसे हो, राउंड, आपने खाना खाया, हाँ नहीं आ रहा है। सो कभी कभी पेशेंट ऐसे बात करता है कि जैसे आप पूरी हवा नाक से आ रही है और वो बिल्कुल जीभ ठीक से उठा नहीं पा रहे हैं, पैलेट अच्छे से काम नहीं करता है, और खाना भी शायद या पानी भी नाक से आ सकता है। और ऐसे में पेशेंट को, व्यक्ति को लगता है कि मैं बोल नहीं पाता हूँ ठीक से, और फिर वो लोगों से बात करना कठिन हो सकता है, अवॉइड कर सकते हैं। सो ये है अलग फ्लासिड डिजार्थ्रिया, ये भी स्ट्रोक के साथ हो सकता है। अटैक्सिक डिजार्थ्रिया, ये एक टाइप है जहां पे मैंने कहा छोटा ब्रेन, मस्तिष्क में एक छोटा ब्रेन होता है आपका सेरिबेलम, जो कोऑर्डिनेशन में बहुत इंपॉर्टेंट होता है। सो जैसे कोई पी के आया हो वैसे साउंड करना, ड्रंकन स्पीच जैसे बातें आ सकती है स्ट्रोक के बाद, अगर छोटे ब्रेन को सेरिबेलम स्ट्रोक हो गया हो। और काफी पेशेंट्स होते हैं जो ऑलरेडी अल्कोहलिक होते हैं। मैं देखती हूँ कि बहुत सारे रूरल बैकग्राउंड से आने वाले लोग, गांव से आने वाले व्यक्ति, या फिर शहर में भी बहुत ज्यादा पीने वाले व्यक्ति, तो आपको तो पता है स्मोकिंग, अल्कोहलिज्म आर रिस्क फैक्टर्स टू हैव स्ट्रोक। सो इट्स इम्पोर्टेंट दैट अंडरस्टैंडिंग कि यस, ये पहले से अल्कोहलिक थे, सो शायद उनका छोटा मेंदू, छोटा मस्तिष्क, छोटी ब्रेन, सेरिबेलम could be weakened already, और डिजेनरेटिव पैथोलॉजी पहले से वीक होने लग गया है और उसके बाद में स्ट्रोक आ गया है, तो शायद वो ड्रंकन स्पीच हाईलाइट होता है, हाइटन होता है। तो इसे भी एक्सरसाइज करने होते हैं। तो क्यों जरूरत है कि टाइप ऑफ डिजार्थ्रिया क्या है? क्यों जरूरत है? क्योंकि जैसे जटिलता बात करने की, कौन सी सिस्टम इन्वॉल्व है, उसके लिए हमें क्या करना चाहिए, ये भी बहुत इंपॉर्टेंटली स्पीच पैथोलॉजिस्ट को, स्पीच थेरेपिस्ट को पता होना चाहिए। और उस हिसाब से आपके प्रोफेशनल स्पीच के डॉक्टर, स्पीच पैथोलॉजिस्ट, स्पीच थेरेपिस्ट, न्यूरो में हम जब देखते हैं काफी लोगों को पता नहीं होता है कि पीडियाट्रिक स्पीच थेरेपिस्ट, बच्चों की थेरेपी अलग होती है, और एडल्ट जो स्ट्रोक होने के पहले एक अच्छा इंसान करने वाला, घर में काम करने वाला होता है, और फिर उससे स्ट्रोक आता है तो बात करनी अलग होती है। सो स्पीच थेरेपी इज डिफरेंट व्हाइल यू आर डीलिंग विद चिल्ड्रन, यंगर चिल्ड्रन, डेवलपिंग ब्रेन्स। और इसके लिए टाइप क्या है, ये डिजार्थ्रिया है या अफेजिया है या अप्रैक्सिया है, प्लानिंग प्रोग्राम नहीं कर पा रहे ठीक से बोलने के लिए, ये दिक्कत है, ये समझना बहुत इंपॉर्टेंट है। देयर इज वेरी essential need for professional to understand, so that the person who is a professional specialized in speech, language, cognition, swallowing should know what is a type of aphasia, type of dysarthria, type of apraxia. Is this three together in one person post stroke? And what could be my approach? What could be my technique? Also the caregivers, घर वालों को क्या बोलना चाहिए, उन्हें क्या बताना चाहिए, प्रैक्टिस क्या करनी चाहिए, जब पेशेंट एडमिट हो उन्हें क्या बोलना चाहिए। इसीलिए जानकारी लेना जरूरी है कि कौन सा टाइप ऑफ डिजार्थिया है। आप बोलेंगे अगर हमारे पास अभी भी कोई थेरेपिस्ट नहीं आया है, तो जब भी लगता है कि हाँ बात करने में दिक्कत है, तो आपको पहले डॉक्टर से पूछना है कि हमें किसके पास जाना चाहिए। सो अगर आपका फिजियोथेरेपिस्ट बोले कि नहीं हम कोशिश करते हैं, कुछ एक्सरसाइज करते हैं, तो उन्हें वापस बोलना है कि बात करने के लिए हमें कोई स्पेशलिस्ट की जरूरत है। So sad to say, but that I have seen people who are physiotherapists, or sometimes they are quack, they're just diploma holders, and they are not specialists in the stroke care, but they are trying to help in a system, but are not adequately doing proper exercises. So face exercises is part of physiotherapy also, I don't deny that. लेकिन speech therapy आपको इक्विप करती है, स्पीच थेरेपिस्ट को पता होता है कि कैसे काम करे डिजार्थ्रिया पे, अप्रैक्सिया पे, अफेजिया पे। सो राइट रेफरल टू द राइट पर्सन, प्रोफेशनल इज इम्पोर्टेंट। ड्रूलिंग आप पूछ रहे हो, ड्रूलिंग मतलब सलाइवा, लाल जो टपकती है उससे कैसे काम करे, एंड ड्रूलिंग इम्पैक्ट वर्ड प्रोडक्शन। हाँ, अगर आपके मुंह में आपने कुछ खा लिया हो और आप बात कर रहे हो, तो शायद आपको पता होगा कि हर एक वर्ड, हर एक साउंड क्लियरली नहीं आ पाएगा। स, थ, ख, there are some sounds which require precise articulation, so air mechanism, then adequate stress to produce that sound is required. और कभी-कभी जहां पर पेशेंट के पास बहुत सलाइवा इकट्ठा हो रहा है मुंह में और वो निगल नहीं पा रहे हैं, या फिर एक साइड की ड्रूलिंग और डेविएशन है, तो वो मुंह बंद नहीं कर पा रहे हैं, तब शायद साउंड प्रोडक्शन, वर्ड प्रोडक्शन, सहज सरल वाणी, वाचा, स्पष्ट उच्चार अफेक्ट हो सकता है, मरीज बात नहीं कर सकता है। और इससे ड्रूलिंग से आपका वर्ड प्रोडक्शन, बात करना, सहज बात करना, स्पष्ट बात करना कभी कभी नहीं तो हमेशा कम हो सकता है। अगर आपको सेंटेंस में बात करनी है, अगर मैं ऐसे बात करती हूँ तो भी मैं बात करूंगी, लेकिन आपको समझ में आ रहा है इसलिए, अगर मुझे बोल रही हूँ ऐसे और आपको समझ में आ रहा है मैं क्या बोल रही हूँ, दिस इज क्लिंच टीथ। और कभी कभी होता है कि स्ट्रोक के बाद में मरीज मुंह नहीं खोल पाता है, और वो जो बोलता है वो मुंह के अंदर ही रखकर बोलता है, तो हमें समझ में नहीं आता है कि क्या बोलना है। और इसी चक्कर में आप बोलोगे कि मुंह खोलो तो शायद ज्यादा लाल आती है, तो कुछ मरीज क्या होता है ना, वो कोशिश करते कि लाल नहीं आनी चाहिए बाहर, तो वो अंदर ही अंदर लाल रख के रखते हैं, लेकिन निगलते नहीं है, और वो कोशिश करते कि मुंह ज्यादा खोले नहीं, उनको पता होता है कि मुंह खोलने से लाल आती है, तो वो मुंह बंद करके भी बात करते हैं। तो श्रीधर, dysarthria is different, aphasia is different. They are two different speech, language, neurocommunication disorder. In aphasia, if it is non-fluent, like Broca's aphasia, if you remember last time we have discussed, that Broca's aphasia can have dysarthria concomitant. The Broca's aphasia can have Apraxia also. But if it's pure Dysarthria, that means someone cannot speak clearly, and the systems of respiration, phonation, articulation, word formation, and a single word to the sentence level clarity may be impaired. So Dysarthria is so much motor speech disorder. Your motoric function is affected, which has a weakness, is one important concept. So मस्तिष्क से आने वाली नसों से सप्लाई करने वाली स्नायु में वीकनेस है. So drooping या फिर sluggish speech, tongue movement could be sluggish. The person cannot adequately hold the breath, adequately hold the air. So some exercises are required to strengthen the muscle. So one should know what muscles are weak. Okay. So आपको मैं दिखाऊंगी. I'm still not able to share the screen, Shruti. Sorry, sir.
Okay, you would like to share your screen? आप screen share करना चाहते हैं? I'll make you, मैं आपको host बना देता हूँ फिर. एक मिनट, just एक मिनट, give me a minute.
Ma'am, is it possible for a person to have aphasia, apraxia, and dysarthria all together?
Yes, right question you asked. We get to see many patients when there is a left brain stroke affecting right side of body. Okay, you're a right-handed person, so I write with my right hand. So my language is assumed to be on the left side. So when there is a left stroke of either frontal lobe, temporal lobe, parietal lobe, one can have difficulty in getting correct words, difficulty in writing, reading. So communication can be important to be affected.
अब शेयर कर सकते हैं आप सोनल जी, कैन यू शेयर योर स्क्रीन? I think we have lost you, Sonalji. Yes, maybe she'll have to reconnect.
Meanwhile, anybody has any questions, we can start putting in the chat box. So she is addressing it simultaneously.
Right.
I'm sorry. Not a good day for my action, I feel. Very sorry for this.
Ma'am, I asked you this question particularly because my husband, he had absolutely zero speech and no sensation till his throat after his stroke. And slowly the sensation had to be induced with the help of exercises, the candy stick and the spoon and all that. Then slowly the therapist started with single sounds. So we had to make him understand to pronounce individual sounds, each sound one by one, then joined single sound, two sounds to make one small word, two words. So this is how now we are at the sentence level. He is said to have dysarthria and apraxia together. So that's the reason I asked you this question. And moreover,
yes, so one can see.
Okay.
One can see that concomitant or comorbid, co-occurring disorders. So getting correct words is not a problem in dysarthria. शायद लोगों को बात करने में दिक्कत है क्योंकि वो वर्ड बोल पाते हैं लेकिन वो स्पष्ट नहीं बोल पाते. One may have difficulty in speaking clearly. So stress getting rightly a word, say p, b, t, d, g, श्रुति, श्रुति पानी चाहिए मुझे, श्रुति अभी जल्दी आओ. So say it loudly, clearly, without any hesitancy, without any disfluency, without any stuttered output, without any unclear, mumbled nasal output. So that is dysarthric output. And when there is difficulty in getting correct words, not able to find, okay, उसे क्या बोलते हैं, वो चाहिए मुझे, वो, So not getting correct words of that is aphasia. Anomia, not getting correct word, hallmark of aphasia. But aphasia is beyond that. Sometimes patient just doesn't understand what is spoken. Sometimes patient just can't repeat correctly. So how do I assess person's speech? So I would tell you, there's a quick screener one should know. What I can do is I can flash simple cards. So you all know this simple tool available online. So where we can share the naming picture objects. So show some pictures. ये क्या है? So ये तितली है, ये मोर है, ये zebra है, ये tiger है. What is that? So this is called naming. So Shruti, do you want your husband to name aloud? Will you volunteer?
Name the object. Allah, name that. What is in that slide? What is there?
Tiger.
Will you try, sir?
Yeah.
Guru Raj?
Tiger.
Yes.
Tiger.
And
Pot.
what is there next to the tiger?
Amane.
Now, say it again. What is that?
Pet.
So now, getting correct words as well as saying it clearly. So these both are affected. So how do I approach that? Yes, there is a weakness in his tongue. There is difficulty in getting correct words. There is difficulty in also executing it rightly. So I will ask him, so can you repeat tiger,
Tiger.
titli,
Titley.
butterfly,
Butterfly.
zebra?
Zebra.
Now, this is the Dysarthric utterance. I'm asking you to repeat and he is unable to repeat clearly, right? So somewhere what is lacking is right stress, right air which is supposed to be exhaled with each word, and that requires your muscular praxis. That's a skill. So how do I produce my sound or word? There is a set important rules in my brain that when I say p,
Pa.
Guruji, say bolo p.
Pa.
This is
Pa.
clear. Now say b.
Ba.
B.
Ba.
B.
Ba.
So now he is able to say p but not b. आप बोलेंगे t,
Ta. Ta.
t, t, t,
Ta. Ta. Ta.
ta, ta, ta,
Ta. 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 Ta.
t, 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 t.
Ta. 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 Ta.
So saying ta is easier. It's relaxed. Saying t is difficult. And
Ta.
now you can understand that could be helpful. So vowels a, e, u. बोलेंगे please.
A. U. E. A. U. E. A. U.
रुकिए.
E.
रुकिए. Now this is exaggerated movement and he is missing the sequence. So we need to ask the person first. You can simpler, you can show some cards, show some objects. इसे क्या बोलते हैं? If the person knows more than 2 languages like Telugu, English, Shruti, what do you speak at home as a mother tongue?
Kannada and English, and he is good with Hindi also.
Okay, good. So you are a
Family.
multilingual. So जब आपको हिंदी में बात करनी है, तो हिंदी diction अच्छा होना चाहिए. Pronunciation, diction, articulation goes hand in hand in terms of p, b, t, d, k, g. Indian languages has lot of t, d, l, n usage, whereas English does not have so much of l or n or t, or you don't have all. No, at all. There's nothing, not that part of alphabet of English. So one should understand that every language has a different rules of their alphabet and their swar, vyanjan, vowel and consonant, and that makes it difficult. So it's possible that person can be fluent in one language and not so fluent in other. So your mother tongue, we tend to see people improve faster because that is engrammed in the brain from the childhood. And बहुत सारे लोग बचपन से इंग्लिश नहीं सीखते, शायद वो छठी सातवीं से कक्षा से इंग्लिश सीखता है, जहां पर बचपन से ही इंग्लिश सीखते हैं तो उन्हें इंग्लिश भी उतनी फ्लुएंटली बात करनी आती है. So I'm going to help you understand now how you can quickly screen that is it dysarthria, is it aphasia. Gururachi, will you please volunteer so I would help others to learn also.
Thank you.
And I promise you will learn something new if you have not worked on the same exercises earlier. Okay?
Okay.
Thank you. Okay. So, will you tell me what is the animal you see here which can eat animals, which can eat a man also? So, I'm simplifying and I'm talking in complex. Huh?
Tiger.
So, understanding and then getting rightly a word. यहाँ पे ऐसी कुछ चीजें वो जो हल्की फुल्की होती है, यहाँ वहाँ वो लहराती है, बाग में होती है, फूलों पे आती है.
गार्डन ಅಲ್ಲಿ ಇರುತ್ತೆ, ಫ್ಲವರ್ ಮೇಲೆ ಕೂತ್ಕೊಳ್ಳುತ್ತೆ.
Butterfly. Butterfly.
Yes. So he could understand and he could get a correct words, but it was a bit late. So getting the correct word requires and also answer, whereas quickly understanding and saying butterfly, titli, or full pakhru, whatever language you speak. Clarity, that stress, that fluency, that is a speech production, which requires you to first plan in your mind. That's a butterfly. I should say b, then t, then r, then fly. Is it bitterfly? Is it butterfly? Is it batter? I. So this is the coining the word, and that may get impaired post stroke. So praxis, verbal praxis, for the word to the phrase to the sentence level could be different, and we have to understand that's a praxis. A praxia of speech can hamper someone's coining of word rightly. So someone can say tiger, then tiger. So for you and me who have no brain damage, a good vascular brain, blood supply to the brain, may easily get quick words. That's a verbal fluency. So Shruti ji, will you ask him to say in a minute as many animal names as possible in Kannada? That's the most preferred language for him.
Kannada.
1 minute.
Usually mixes languages, ma'am.
Okay. So there is a switching and mixing of language. So will you tell me in a minute as many words as possible from letter P?
Letter P.
Peacock.
No, you should see that.
Peacock. B.
P, pa, P, pu, pe. Any word which starts with P. Letter P.
Pass. Vada. Marivada. Okay. So मैं बोलूंगी, अगर मुझे पूछा किसी ने, पानी, pig, palak, palat, paper, pehle, pareshan. So you go on saying the words. But somewhere the clarity, getting correct words could be impaired post-stroke, and that could be also important task to just ask, 1 minute में आप कितनी चीजें बता सकते हो? 1 मिनट में आप कितने फलों के नाम बोल सकते हो? In a minute, generate as many names of the animals or names of the companies or names of the movies, or can you name one movie name, one actor name as fast as possible? So there are people who love Bollywood, heroines, movies. There are people who are so much into their work, bank, account. There are people. So as per the familiarity, your fluency would differ. So I would tell that whatever you liked, whatever you earlier did before the stroke could be also considered while asking the question. For people who are listening to me here, check with your caregivers, with your patients, if you are able to generate in a minute at least 10 words or not. And how are you generating that? Time it. It has to be time task. So, गुरुराज जी आपने 5 से 6 words बोले. When you're not able to speak clearly, what happens? Someone may not understand. So, speech perception is not with the listening and speaking. मैं जो बोल रही हूँ आपको समझ में आ रहा है? Are you able to understand what I'm saying? I'm trying to make it as simple for people who are not speaking English here. So, not everyone who has joined meeting are English speaking. So, I'm trying to tell you this in Hindi. लेकिन हम सब जब सीखते हैं, हम सीखते हैं इंग्लिश में या फिर हिंदी में या फिर अपने मदर टंग में, तो हम नहीं बोल पाते टेक्निकल चीजें उसी फ्लुएंसी से, लेकिन रोजमर्रा की चीजें हम बोल पाएंगे, है ना? तो 1 मिनट में एटलीस्ट 10 तो एनिमल्स, 10 जानवरों के नाम आप बोल जाना चाहिए. लेकिन कभी कभी क्या होता है, तीसरा और चौथा एनिमल का नाम ही नहीं आ पाता है. So that is difficult in getting correct word. That requires the executive function, attention, and word retrieval system to be intact. And post-stroke, that could be impaired. So getting correct word, speaking it, producing it rightly, saying it in a longer sentence, or writing. So there are different tasks one can give it to person with neurocommunication disorder post-stroke. So you have a modalities. Speaking is a modality. Understanding is modality. Writing is modality. Listening is modality. Counting is a modality. Yes, and singing is also very important to be tested. So गुरुराज जी आप आपका फेवरेट गाना गाओगे प्लीज? कोई भी गाना.
स्तोत्र.
ओम वेद नमः वैदि ओम नाना आत्वा पैतकं महामहे वेष्टम वेष्टवास्तगम एष्टद्वादममना बत आनस्तोन्नति वेष्टवादम ओम महाभते नमः वैनो देवी सर्वशक्ति हे देवी वनवती आनवतु ओम
Okay,
वाग्देवी नमः.
Fine. So Shruti,
Yeah.
and to everyone here, it happens that when patients post Broca's aphasia or transcortical motor aphasia, that means they are non-fluent in nature, that initially they don't get correct words at all. They are just at sound level, but they understand. When they are improving, the journey starts from the no words to few words to few phrases to sentence level. Dysarthria does persist, and dysarthria could be residual in some stroke patient from the severe level to moderate to milder level. And some patients, more you speak, faster you speak, quicker you speak, the articulators, the muscles are not supporting so easily and they give up. And there it could be sluggish sounding. So, शब्द में बोल पाना possible है, सरल से बोल पाते हैं, लेकिन शब्द से बड़ा वाक्य बोलना है, शायद उसमें जैसे पेशेंट मरीज सीवियर बहुत पहले से रिकवरी फेज में जहाँ पे स्ट्रोक आता है, उसके बाद में जैसे वो संभल लगता है, इंप्रूव होने लगता है, अच्छे होने लगता है, तब डिजार्थ्रिया, स्लगिश स्पीच
अनक्लियर स्पीच, वाचा स्पष्ट नहीं होती है, उच्चार स्पष्ट होता नहीं है, ऐसे पॉसिबल है कि ज्यादा फास्ट बोलने लगे, बड़ा सेंटेंस, बड़ा वाक्य बोलने लगे, तभी डिजार्थ्रिया एविडेंट हो सकता है कि ज्यादा बंदे अच्छे से स्पष्ट नहीं बोल पाते, लेकिन शब्द जब बोलते हैं तब वो शायद सरल से, सहज से बोल सकते हैं. सो ऐसा क्यों होता है? brain is capable of learning, relearning, and when you don't practice, it gets somewhere affected. Post stroke, जहाँ पे blood supply कम होता है brain में, तब वो pathways होते हैं broken, interrupted. So वहां से शब्द सरल बोलना, वाक्य चयन करना, वाक्य बोलना और बड़े वाक्य बोलना, so वहां पे जटिलता होती है कि आपको टंग मूवमेंट्स, जीभ और फिर आपकी टंग मूवमेंट्स, लिप मूवमेंट्स, बकल कैविटी मतलब जीभ, होठ, और उतने सरलता से ये सब को हिलाना और फिर वाक्य से बड़ा वाक्य बोलना. जैसे मैं बोल रही हूँ पानी, पानी चाहिए, मुझे पानी चाहिए अभी. सो जितना ज्यादा यूज करते हो, इस्तेमाल करते हो, उतना अच्छा स्किल होना चाहिए. छोटे छोटे चीजें, छोटी छोटी वाक्य, छोटे छोटे टास्क करने में हमें कुछ दिक्कत नहीं होती है, हम सरल से कर पाते हैं. जैसे कॉम्प्लेक्सिटी बढ़ती है वैसे शायद डिजार्थ्रिया बढ़ता है, अनक्लियर, अस्पष्ट उच्चार बढ़ सकते हैं. सो ये भी पॉसिबल है कि डिजार्थ्रिया और अप्रैक्सिया कैन गो हैंड इन हैंड विद सम पीपल हु कांट होल्ड अ कॉग्निटिव लोड, अ ह्यूज लोड ऑफ कन्वर्सेशन. जब हम किसी को बोलते हैं कि आप एक वर्ड बोलो, आप मेरे पीछे बोलिए गुरुराज सी, ओम,
ओम,
गंग,
ओम,
गणपतये नमः,
पार्वतीये नमः,
ओम गंग गणपतये नमः.
ओम क्लीं पार्वतीये नमः.
So we are India, a highly populated Hindu nation. However, not everybody will chant, I'm sure. So I'm not being here asking that you all have to learn chant and shlokas on mantras. We all might have some other verses. A Muslim can say surah, kalma. A Christian who will be seeing some choirs or some verses. So I would see and tell you that with my experience, every patient who comes to me post-stroke, only 1% say that no, I don't believe in God. Rest 99% people say, yes, I am connected to my religion, my God, and I want to connect, I want to sing, I want to go to church, I want to go to a masjid, I want to go to a mandir, I want to connect with my family and chant or say arti or bhajan. So something what gives you power, a positivity is connecting with your spiritual higher supreme version. And when you can't speak clearly, that could be a kind of a burdensome for you. Just like how you just said nicely, recited a shloka. So some shlokas, mantras, verses, you have been chanting for long. It's there in your brain. So working on the same could be helpful. So you speak with tap, okay? And that could be helpful. So let me just give you inner therapy a little later, but now I'm just in the screening level that there's a problem. You require a speech language therapy. You have to seek a right referral. So show the cards, ask the person to count, ask the person to speak, how he's speaking spontaneously on his own, how is he responding when you're asking question, and you understand something is wrong, something is not clear. And then you see that, okay, you get an idea ki when he's speaking in a small words, he's fluent, he's clear, but he is trying to attempt more complex words, complex commands, more sentences. It is somewhere unclear. It is not normal, not natural. So this could be your findings, observations, and you can say this to your speech therapist when you go, and you can try to record. It could be helpful. Next, what you can do, ask a person to stick out the tongue. यहाँ पे जितने पेशेंट्स है वो कर पाएंगे प्लीज. आपकी जीभ बाहर निकालो, नालिका बयटिकी पेटंडी.
Yes.
जीभ बाहर काढा. Stick out your tongue 3 times.
3 times. Okay. Now try to move the tongue up and down. जीभ वरती आणि खाली करा. जीभ बाहर निकालकर ऊपर और नीचे की तरफ 3 बार कीजिए. जीभ दाई और बाई तरफ घुमाइए. जबान जीभ आतमध्ये गालात फिरवा. जबान अंदर मुंह में दाई तरफ और बाई तरफ घुमाइए और अभी बाहर निकालिए. Try to have your tongue side by side, sideways, move it to left side and right side. Okay, so this could be simple task you can ask the person. Sometimes patient doesn't understand what you're asking, so that is aphasia. That patient cannot process, patient can't execute. That is apraxia, where they can't follow your command. And that could be buccofacial apraxia also, that patient understands you, but he can't get the tongue right. You put forward, back, or up and down. He can't roll it. So it can happen that person can have difficulty in understanding, and so he is not following your command. ऐसे हो सकता है कि स्ट्रोक के बाद में आप जो बोलते हुए करने आप ये कीजिए या आप मेरे तरह से इमिटेट कीजिए, पेशेंट नहीं कर पाता है, तो उसे अफेजिया हो सकता है, जो समझने की बीमारी है, समझने की दिक्कत है स्ट्रोक होने के बाद में. सो समझना और फिर नहीं कर पाना, ये एक है चीज बोलने में कठिनाई आ सकती है, और एक है जो आपको समझ में आ रहा है लेकिन आप सही से मुंह, टंग या पैलेट या लिप मूवमेंट्स नहीं कर पा रहे हो, उस सीक्वेंस में नहीं कर पा रहे हो. ये एग्जीक्यूशन, प्लानिंग, प्रोग्रामिंग, एग्जीक्यूशन, आप ठीक से वही कमांड फॉलो नहीं कर पा रहे हो, ये दिक्कत हो सकती है. सो बकोफेशियल अप्रैक्सिया क्या होता है? काफी सारी पेशेंट मुझे बोलते हैं कि मैम ये क्या लिखा है डॉक्टर ने, उनकी हैंडराइटिंग समझ में नहीं आती है. हाँ, from all the medical fraternity, I would say that yes, many times what people write with the handwriting being kind of always say that all doctors have a poor handwriting. It's not always the doctors. It could be therapists also. It could be any layman also. But we're supposed to know what do I have. So what is the diagnosis you have given me? So you can ask the question to your therapist, your professional, your doctor. Ki, oh, this is spastic dysarthria. This he has written speech therapy recommended. What is spastic? Kadak, spasm, or oh. Every time patient is just saying this oh. I'm asking his name, he's like oh, and he's not able to do the right type of task I'm asking him to imitate. मुंह फुलाइए, गुब्बारे की तरफ मुंह फुलाइए. Hold the air in your mouth. Blow. Act as if you are blowing a candle. So there are tasks which you can make the person follow and imitate. So first you should tell the person, move the tongue to the right side, left side. You can tell the person, keep your tongue in between the both lips and hold it for some time and count in your mind 1, 2, 3. If you see the person is having drooling, लाल अगर ज्यादा लाल होती है मुंह में, तो जब आप टंग आपकी दोनों होठ में पकड़ते हो सकता है कि लाल आ सकती है बाहर, और फिर आपको बोलना पड़ता है कि आप लाल निगल लो. You might have to tell the person that you see there is a drooling, there is saliva, and mostly when it is a right side weakness, the saliva can come from right side, and the left side weakness, the saliva can come from the left side. So wherever there is deviation on command, on movement, or even at rest, there could be some deviation, some drooping. The person may not be able do the task rightly as it is. So Gururaji, I'm happy that you are my volunteer. Can you please do this? You are seeing some picture on the screen, right? Can you do this? धनंजय, anybody else wants to volunteer? कोई है यहाँ पर जो बोलेगा कि नहीं मैं करता हूँ, कोशिश करता हूँ मैं बोलने का, ये एक्सरसाइज करने का? प्रसूना?
Yes, madam, I can try.
या धनंजय बोलो. Hi.
I more so the first.
Thanks for joining, Dhananjay.
Thank you, madam. Move tongue to left side. That way.
Okay. Yeah. You can see this picture and try to imitate the same way.
Okay. Move tongue to right side. Okay. Then.
Dhananjay, your
Yes.
video is not on. तुझा video on नहीं है?
Yes. Just a second. Yes.
हाँ.
Yes. Okay. Then.
Pucker your lips.
Puck lip. The lips.
Blow
Then
bubble.
blow.
जैसे आप गुब्बारे को या फिर बबल्स ब्लो करते हो, हवा भर रहे हो.
That way. Blow the bubbles.
Yes.
Then
हाँ.
say
Next
pee,
is
pee.
say p p p p p.
P, 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 p,
Say
p.
t t t t t.
T, 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 t.
Say
Then
k k k k k.
T, 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 t.
Shruti. धनंजय, थैंक्स.
Thank
आता
you.
गुरुराज, आप बोलोगे? आप करोगे?
हाँ.
बोलिए मेरे पीछे. प प प प प.
Pa 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 pa.
ट ट ट ट ट.
Ta 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 ta.
क क क क क.
Ta 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 ta.
कागज.
Das.
कलम.
Ram.
कैरेट.
I know.
कैरेट.
Date.
कज्जिकाया.
Titaya.
कैबेज.
Cabbage.
क क क क क.
Ta 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 ta.
कल कोई घर आया.
Road. I.
तुम कहाँ गए थे?
Diete.
Cut the paper with scissor. So this is a repetition task. Word level to phrase level to sentence level, you can ask the person to repeat. So this is aphasia with dysarthria with mild apraxia of speech, and that requires a good cognitive linguistic rehabilitation. A speech pathologist should be trained in, and you should be able to get help from. And majority of times with weakness, this is added burden on your speech and language system that one cannot communicate, one cannot hold conversation. So these exercises could be helpful that you first screen. Are there any muscular weakness? Yes, there is. Is there any difficulty in following the rightly all the commands? Yes. And how the person is doing in a set of 3 tasks together, in a task 1 to other. So that's a coordination, that's a sequencing, that's a lot of cognitive load. Simple से हम complex, धीमे धीमे सीधे सीधे से हम सरल से complex कठिन टास्क पे जा रहे हैं. So जैसे ही अपना काम बोलना कठिन हो सकता है, वैसे ज्यादा दिक्कत आ सकती है, रूलिंग हो सकता है, ज्यादा मरीज को दिक्कत होती है बोलने में. तो इसके लिए हमें थेरेपी में बेसिक एक्सरसाइजेस से जटिल एक्सरसाइज करनी शुरू करनी होती है। और कोई है धनंजय और गुरुराज की जगह? और कोई बोलेगा? कोई भाग लेगा? इस सुविधा देर?
Suryam, ma'am.
Surya. I don't know this patient. Is it Surya? Hi.
Hi.
You're also stroke patient or a caregiver?
Suryam, can you speak loudly or just check your mic?
You are muted, Surya. Unmute yourself.
Sorry.
Yeah.
Okay. Yes,
Ma'am, he
ma'am.
is a stroke patient and
Yes, ma'am.
now he can speak up to paragraphs. He has improved really well and his
Yes,
writing is also good. He also attended a job interview.
Yes.
He is doing well and he needs little more support so that he can achieve his goals.
We are all here, Surya, for you. And we want you to get back to your work. You can have that same flair in your English, Hindi, Marathi, whatever language you speak. So, to achieve that, such exercises can be helpful. So, can you be my volunteer? I'm sure
ma'am.
Guru Raj is slightly tired. Dhananjay might like to come in one more time. Surya?
Yes, ma'am.
So, can you try to smile?
Yes, ma'am.
This is the simplest task. Ask the person to smile.
Yes.
And try to ask the person to laugh. And see how are the
Yes,
facial symmetry. Is there
Yes, ma'am.
deviation, drooping, some
Yes, ma'am.
drooling, eyelids,
No, ma'am.
nose,
Yes, ma'am.
and the buccofacial symmetry?
Yes, ma'am.
Versus there is some part of weakness not helping the person speak, hold the air for long. So
Yes, ma'am.
this could be also simpler task to understand.
Yes,
It
ma'am.
require exercises. Physiotherapist, occupational therapist, speech language pathologist, psychologist go hand in hand for the help the person with stroke return back to community. And
Yes, ma'am.
many times people forget that and people don't have adequate teamwork. So I would see all of you, whoever feel that there is some depression, some kind of apathy, some
Yes.
part of emotional burden that easily someone gets tears, may
Yes.
not adequately speak clearly and give
Yes.
stress and say it that clearly. So speech is behavior, you know. When I'm
Yes.
hungry, it will not change. But when I'm upset, it will change. When I'm happy, my speech is different. When I'm sad, when I'm just cried a lot, it will different. So speech is emotion. It's a behavior and it changes. It gets affected by your emotions. When you are sad, unhappy, depressed, very anxious. So post-stroke, people get more anxious when there is a third person. अब इस मैडम के पास जाते हो, बहुत ज्यादा ही डर जाते हैं मैडम, वो बात नहीं कर पाते हैं, बिल्कुल अच्छे से नहीं कर पाते, यहाँ पर घर पे इतना नहीं होता है. So it's possible that person might not do as with the ease, with the comfort level at in the session. So आप कोशिश करो कि आप केयर गिवर यहाँ पे जो है स्ट्रोक पेशेंट्स के, कि अगर पेशेंट थेरेपी में अच्छे से नहीं कर पाता है तो पहले उनको रिलैक्स करने के लिए सिखाना है. बहुत सारी एंजाइटी, परफॉर्मेंस एंजाइटी से भी स्पीच इतनी अच्छे से नहीं आ पाती है. सो परफॉर्मेंस एंजाइटी कैन अफेक्ट योर स्पीच टू सम लिमिट. People who are not able to concentrate, not able to follow well, also have difficulty in using right strategies, that you think, speak slowly. Whenever there is a saliva, you gulp the saliva and then speak. So ये सब हम पहले ही assess करते हैं. इसकी जानकारी रखनी important है, ये जांच करना important है. So पहले आप ओरोमोटर एक्सरसाइज देखेंगे और ये पहले हम टेस्ट भी करते हैं.
Ma'am,
Yes.
Ma'am, words forgetting, ma'am. Words forgetting, ma'am.
You're forgetting the words. So sometimes you feel that you don't get correct words. So that is anomia. So forgotten,
Yes,
word forgotten versus not able to access the word. So,
yes, ma'am.
Surya, what language you speak at home?
Telugu, ma'am. Telugu.
Telugu నాకు కొంచెం వచ్చు. Okay.
Okay, ma'am.
हिंदी आता है आपको?
Before Hindi, okay, ma'am. But after stroke, no, ma'am.
So, tell you, we all are bilingual. So, our mother tongue remains much better and improved after the stroke. But second language, Hindi or English, may see a regression or a slightly decline. So, why does it happen? Something which we learn long back, we use it preferred in everyday communication, can easily improve. Something which is not easily worked at home, spoken with the same fluency, may have a second language regression. So possible है काफी मरीजों में स्ट्रोक होने के बाद में उनका इंग्लिश, हिंदी अगर ये सेकंड या थर्ड लैंग्वेज हो सकती है, ऑफिशियल लैंग्वेज हो सकती है, तो वो शायद 10%, 20% या इवन 100% रिग्रेस हो सकती है. लेकिन अगर आप कोशिश करते हो, प्रैक्टिस करते हो, तो वो आ सकता है. So practice makes your brain work better. So there's nothing that will stop you. You don't stop talking, thinking, reading, writing in Hindi, in English, because if that was you were practicing. And we all in India, you know, you might need to have a neighborhood who is a Punjabi, who talk in Hindi, or in Punjab, people speak in Punjabi as well as Hindi also. So there is a bilingualism. In Maharashtra, we all speak Marathi and Hindi and also official language English. So pani pi lo, people hardly say that. Give me water. Water do. People say that person has said this. ये talk कर रहा है, ये बोल रहा है, ये इसका speech ठीक नहीं है. So you know, we speak two languages together. We switch, we mix, and that could be aphasia, bilingual aphasia, which is important to be working on. So getting correct words, speaking it that fluently, making a longer sentence, aphasia and a praxis, verbal praxis, and then speaking that in intelligible manner. That is somewhere articulation, dysarthria. So I'm trying to tell you in simpler words. You can try to screen this simpler task. So understanding that there is a muscle weakness that requires a practice, that requires exercises. For symmetry, asymmetry is not going to help. You need to achieve symmetry. So working on tone, tonicity, hypo मतलब कम, छोटा, कम होना, hyper मतलब excess, there's a excess hypertonicity, strained, strangulated, बहुत जटिलता से किसी ने पकड़ लिया है आपको, आप बोल रहे हो, Surya, what is happening? What did you eat? This could be a strained, strangulated speech. Surya, don't tell me where you live. This could be a kind of flaccid speech. I'm just trying to simulate it. मैं कोशिश कर रही हूँ कि किसी को ये दिक्कत हो सकती है, शायद थी पहले और अभी आप इम्प्रूव होके आए हो. मुझे पता है बहुत सारे स्ट्रोक पार्टिसिपेंट जो सुन रहे हैं हमें, शायद उनका स्ट्रोक 1 साल, 2 साल, 3 साल पहले था और वो अभी काफी अच्छे से बात कर पा रहे हैं और ये सब कुछ जर्नी इससे गुजर रहे हैं और या फिर गुजर चुके हैं. So I want all of you to become advocate for brain health, that who has a stroke, you can go help them, give them assurance that, see, go find a good rehab professional, take this practice at home, work on online or offline, in person, try to work. You don't lose your motivation. You will improve. Versus someone who is having a bad cholesterol, blood pressure, sugar, habit of smoking, drinking, you can go and tell them that please work on your habits, lifestyle. And we all are highly stressed, you know. The stress is real bad for everyone. But how many of you will have stroke? If you have normal brain, none of us can predict. We don't know. So it is important that we take care of our brains. So prevention of stroke, then if the stroke has happened, if identified, get into the right hospital, giving intervention, then is able to walk, is able to talk, is able to speak rightly, read rightly, write correctly, go back to the work or not. This is also important to be working on. So you all take the simple lessons from this all lectures, this webinar series, that how do we help each other, our countrymen. So Shruti has been so helpful to Stroke Support India. I tell you, Shruti, hats off to you.
Oh, no,
You have been helping so many patients, and I know the efforts you have taken along with helping Guru. So I want each of you to try working on that. So gets back to the speech praxis again. Okay, so this is what could be simpler tasks. You know, how do you work on assessment? जांच करो ये दिक्कत है या नहीं है. Holding a spoon in your mouth will be better in case you don't have ice cream stick. So tongue depressor or a spoon holding in your mouth. And if the person is not able to hold it, there is a poor holding, lip musculature weak, whatever the object, be it a ice cream stick or a spoon, could fall. So then there is a need to work on the lip strengthening. So you have to identify, is it right or left? Is it lip or tongue? Is it palate? कहाँ पे कठिनाई है? कौन से मसल्स ज्यादा वीक है? राइट साइड, लेफ्ट साइड या बोथ साइड? और उस हिसाब से जांच करके एक्सरसाइज करवाना इंपॉर्टेंट होता है. तो वो हम करते हैं. सो एज अ स्पीच लैंग्वेज पैथोलॉजिस्ट, I try to evaluate patient at bedside in ICU, in general wards, private wards, or the rehabilitation wards, or if someone has a stroke and someone has gone home to assess the patient, you all have to do this task very importantly, oromotor exercises as a task for assessment. Okay. Next, move to the different task.
Excuse me, ma'am.
Yeah.
Ma'am, is it really, is it important for all persons with aphasia to do oromotor exercises, or as advised by the SLP?
Okay, right question. So, Shruti, not all the person with aphasia require oromotor exercises. There are some stroke which affect only posterior brain, temporal parietal. There, it's a sensory aphasia we get to see. That they are absolutely fine with their tongue movements, lip movements, palatal movements. There's no weakness at all. And there, you don't have to do oromotor exercises. But I would always say, doing some exercises of tongue will always help. And even if it is not needed, if you add tongue movements, exercises, even as a brain gym, from a mind, body, medicinal, neuro rehab, yoga perspective, people say doing some healthy exercises of your eyes, of your tongue would be helpful. And why not doing this in post-stroke also, right? So it would be helpful to do at least tongue lateralization, then puckering. So first slowly, then fast for just set of 3. Or you can have some chanting, recital, shloka, or tongue twisters. Will not be wrong. So oromotor exercises, if it's not needed, are not indicated. There is no hard and fast rule that every patient with stroke has to do it. But if it's required, you really need to learn, see that it is not only once you are doing it in therapy, but every day, 3 to 4 times. थेरेपिस्ट आप कुछ सिखाते हैं और आप घर आते हो बोलते हैं मुझे अच्छे से आना चाहिए, सब कुछ ऐसा नहीं होता है, आपको प्रैक्टिस करनी पड़ती है. सो काफी पेशेंट्स बोलते हैं कि ये ठीक से नहीं कर पा रहे, घर पे कुछ भी नहीं करते. तो द बेटर द रिकवरी वेयर यू हैव गुड प्रैक्टिस. आप अच्छे से सो जाओगे अगर आप प्रैक्टिस करोगे.
Ma'am, what about cognitive rehabilitation? One of your previous sessions I had attended, you said that cognition is not separate from speech. So I encourage everyone, to check into this auditory comprehension, then reading comprehension, listening, and this comprehensive skills. For all types of aphasia, dysarthria, cognitive rehabilitation is a must.
Yes, very rightly you have pointed that, Shruti. So cognition is very important. So emotional cognition, motoric cognition, sensory cognition, there are different types of cognition, and attention is the first thing. You have to be vigilant. You have to have a right executive function. So this per-ter-k in a sequence, the lip movement, it's a faster articulatory drill, slower articulatory drill. So this is a motoric cognition for diadochokinesia, we call it. Now, cognition has so many spheres, so many different types and tasks to do. So some people do not understand that. Some people say rightly cognition is only memory. It's beyond that. So I should be first aware of my errors, and I am getting feedback. So getting awareness and working on those errors is also metacognition. मुझे पता है मैं गलत कर रही हूँ. जब भी मुझे ब बोलना है मैं प बोल देती हूँ. ड बोलना है मैं ट बोलती हूँ. मुझे मुंह खोल के बोलना चाहिए लेकिन मैं नहीं बोलती. तो शायद इसे समझना, मैंने शायद बहुत फास्ट बोल दिया, वो ठीक से नहीं बोला है, तो मैं रुकूंगी फिर वापस बोलूंगी. इसे भी अवेयरनेस बोलते हैं. This is also part of first step of cognition. Then you have awareness building, feedback mechanism, then you correct yourself. So that is a kind of one work which requires understanding it rightly and executing it rightly. Then you learn, you relearn, you forget, you again learn. So learning exercises rightly, practicing rightly also requires cognition. If I'm not motivated, if I'm depressed, I may not do rightly, I may not listen. People post-stroke develop agitation, frustration, depression. They require psychological help. And if there is a neurotransmitters in the brain which are not adequately synthesized, secreted, and they require a neurological, psychiatric help, so you need to ask your doctor that, sir, बहुत बार रोते हैं, ये बिल्कुल काम नहीं कर रहे हैं, बिल्कुल एक्सरसाइज नहीं करते हैं, और जाकर जस्ट बैठ जाते हैं और जस्ट कहीं पे देखते हैं, उन्हें पसंद नहीं है काम करना, एक्सरसाइज करना, तो मैं क्या करूं? So you need to work on the drive that I want to improve, I want to do it, I will exercise. So this is also cognition. So emotional cognition is also very important. Motoric cognition, I was again telling you about per-ter-k. So per-ter-k, moving your lips to the tongue, to the palate. This is again a praxis, verbal praxis. That's a part of cognition. Many people don't understand that this requires, ma'am, no cognition. ये cognition task नहीं है. Yes, to have integrated system for a speech is cognition. It's a motoric cognition. So saying it per is different than saying per-ter-k. 1, 2, 3, 3, 2, 1. It's different. So pa, pi, pu. So a, e, u. This is also motoric integration. So one may make repeated errors in learning it rightly, executing it rightly. And that's how somewhere g and d, or the some voiceless, unvoiced sounds, someone will have a jumbled or mumbled output or a missed output. So that's cognition. Coming back to again poor attention, that you somewhere easily get lost, and then whatever has been taught may get missed. So ऐसे होता है कि लोग जल्दी भूल जाते हैं. तो भूलना, उसे भी बहुत अलग चीजें देख सकते हैं हम, कि हम अगर ठीक से नहीं सुनते हैं, नहीं देखते हैं, नहीं सीखते हैं, तो हमें बताया गया हम नहीं सीख पाते हैं, और वो भूलने नहीं है, उसमें उसे भूलना नहीं बोलते हैं. हमने देखा है, सुना है, सीखा है, और फिर हमने नहीं ठीक से सीखा और हम भूल गए, इसे भूलना बोल सकते हैं. या फिर पहले सब पता था लेकिन अभी बिल्कुल याद नहीं आ रहा है कि मैंने कभी ये सीखा है. So I have a patient who is a rehabilitation professional and had a stroke post her second delivery. It was very fatal and it was really bad that they couldn't save the baby. And we see many patients, many younger ladies with the prolonged oral contraceptives have developed the hemorrhagic stroke, and she was very depressed and she was not able to come out of the depression. She would cry. There was spells that she would just not listen, and we tried to work as a team to help her psychologically get support, then work on her physical exercises, work on her mentation, her speaking, her communication, her swallowing. Have a family member, caregivers convey that you speak slowly to her, she will talk to you. And we tried working as a team. So yes, it is important that you work on person's speech, person's language, person's communication. So Diji, I've taken extra time. I hope I can have 10 more minutes.
No, that's perfect. No worries. We are past time, but thank you. Shukriya बहुत आपके efforts में. It's coming. It's a very interesting session. So
No, I wanted to make it very much interactive and not just slides and a lot of jargon of technicality.
Absolutely, that is better. Take as much time.
I got very less patience from North India this time. I don't know why. Our North friends are not joined with us today.
There was some initially, but I don't know how it is presently.
But I'm happy that at least how many are staying back with us? There are 10 people. Yes. So you can try doing the exercise 1. Okay. These are the CNEQ cards. I don't know the lady's name who has made these wonderful pictures available online free of cost for all the speech pathologists. It's posted in the medical SLP group, and these are efforts of one friend of mine, nice speech lady, Becca Wilson. I remember she's sharing with me and on the group. So I am sure this can be helpful for all of you. You can search online. So see, look at the exercises. So this is for your facial nerve. So for your wrinkle. So sometimes what happens, patients post stroke develop one side palsy, and they cannot raise the eyebrows. This is important. You'll say, ma'am, why? So you speak, you articulate, you express not just with words, but also with facial expression, body language. So having the right facial muscles activated post-therapy is important. Post-stroke with therapy is important. So you can do some simple exercises that ask this task first. Okay, close your eyes. Open mouth. Just keep it at rest and see how the symmetry is. When you open the mouth and close your eyes, when you open your eyes and raise hand, sometimes there's a dissociation. So on some task, patient do not follow correctly. So going right or wrong way. जब उन्हें बोला हमने कि हाथ ऊपर करो तो वो पैर ऊपर करते हैं. उन्हें बोला कि नाक पर हाथ लगाओ तो कुछ और ही समझ के करते हैं. So this is somewhere not understanding and not following. They go hand in hand. So understanding and following instruction. So aphasia, apraxia can limit the execution. However, exercising for speech clarity requires understanding and execution rightly.
Excuse me, ma'am.
Ask the person.
Excuse me, ma'am. I have a question. Yeah. For persons who are with tube feeding, in case they have aphasia, it's because I have met a lot of people who say that since they were in tube feeding, their assessment was postponed by months altogether. Then after 6 months after a stroke, we came to know it was an aphasia. So we have a person in our group which has happened to his daughter, and there are many other people whom I met. They said that the assessment has not happened in the hospital. We didn't know that their loved one had an aphasia. So this is my first question: whether with tube feeding, is it possible, not possible to assess?
Second absolutely, it should not affect if there's a nasal tube. I have asked that we will have one session on swallowing itself. So there is a nasal tube, nasal feeding, or many times when there is severe dysphagia, we long-term care, we go for a PEG feeds when there's a brainstem stroke. So there's a severe form of stroke which affects the swallowing. But even there is a tube feeding in normal person, it shouldn't affect your speaking. So speech is not affected by thing, and then you can obviously have the assessment of language, speech with the rise tube. However, a foreign body, one may not feel comfortable whenever there is a tube inside the nose. But saying yes, no, asking, repeating, then gulping, then reading, writing aloud, doing exercises will not be hampered with the presence of tube. So there shouldn't be anybody getting delayed assessment because of there is a Riles tube or the PEG tube. So first thing is right informed SLP.
Tracheostomy tube.
Yes. So tracheostomy is a hole is made in your neck so that the person gets air when you are not able to take right oxygen from your nose, and there's a secretion, the person is not able to maintain right amount of saturation and oxygen from the mouth because there is a vocal fold palsy, patient is unconscious or cognitively very poor, also comatose, and having a secretions entering in his lungs or below vocal folds, and there is a risk of aspiration repeated, and he or she cannot on her own breathe normally. So this is the breathing hole and the tube is placed here. Then the talking won't be possible because there is a hole here. Stoma, okay? There are speaking valve. So this stoma has a size of from the larger to the smaller and smaller. So with the small size, one can close it and tell the person to say ah, and then there could be a lot of secretions which can affect the person to phonate if he or she cannot close it. So unless he or she has a decannulated, we cannot do active voice speech therapy. But communication can surely do. One should get right communication therapy even when the person has a tracheostoma. Okay. The first thing, if the person has a tracheostoma and he or she is aware of surrounding, conscious, able to follow certain things, okay, you want it or not, just blink. So then you have to first understand either person has a global aphasia, whether he doesn't understand and express at all, but he still wants to communicate. So giving a simple picture communication board at the ICU, at the ward with a person who has a tracheostomy is right. And there won't be any difficulty if you can work on lip movement, tongue movement, or some simple exercises with a tracheostomy. So secretion management, swallowing management with tracheostomy is also part of speech language pathology services. And aphasia, dysarthria also need to be worked, intervene when the person has a tracheostomy. They shouldn't deny your therapy. For 6 months, that's not good at all.
Ma'am, this has been really a very valuable information. Ma'am, relating to this, I want to ask you, if the caregiver doesn't know that their loved one has aphasia, but even a scan can reveal it, right? You know, in this particular region, whether it's in the Broca's area or Wernicke's area, even then, you know, it is possible to understand that the person has aphasia, because there are many people, even in our own group, you know, whom I have been meeting, who talk to me one-on-one when they join the group or message me. They say that they have not been assessed at all. So even today I have spoken to a person in our group telling that please get an assessment. She said slow and slurred speech. I said first is an assessment, and they really don't know that the scans can be you know, related to their condition. Is it really possible that the scans can be related to the condition in the hospital itself? This is my first question. Second is, I just saw your paper. I have seen it long back. In this the current state of, you know, how the aphasia is assessed in our country, in the hospital level itself, with Puranik sir and Dr. Goswami sir, the same, you know, aphasia not yet at the high
group,
table.
our paper.
Yeah, your paper, ma'am.
Working on
Annals of Indian Academy of Neurology, yeah, this paper. So in the last, the conclusion, you know, whatever it says, you know, it was published in 2020, this conclusion, whatever it says, it is very much relevant.
Every patient post-stroke should get an assessment.
Yes.
That is able to speak, is able to rightly say his name, sentence, is able to read, write, understand. So, you know, that act fast symptom, that can be quickly done at bedside. Now, we all need to make sure that stroke protocol is not just giving the medical intervention, but also assessing the person with a stroke severity scale. So there is a NIHS scale you are aware of, National Institute of Health Stroke Scale. There, aphasia, dysarthria is also very importantly assessed. Simple pictures they have shown, and you tell the person, is she able to name? Is she able to read? Is she able to repeat? And mild, moderate, and severe, you get a score out of that. So every person with stroke should be screened at bedside by nurse or general physician treating doctor. Neurophysicians are well known to treat stroke and also related symptoms. So aphasia, dysarthria, dysphagia gets screened. However, rehabilitation may start late based on the availability of speech language pathologist, speech therapist in the hospital. So, you know, we see patients at bedside because we are trained, we are into neurological rehabilitation. There are people who are not practicing in neurorehabilitation and they deny, and that's how the patient may not get adequate rehabilitation rightly on the right time. You delay the therapy, the patient may have a negative impact on speech. So earlier the rehab, better the recovery. Yes. Communication is key for your lifelong successful living, right? You are a communication, you are a human being, you want to communicate. So speaking correctly, speaking clearly is important. So scans, what you're telling me, that based on the scans, I have seen very bad scans, very severe stroke, might have a mild aphasia only. That is possible because the brain has already taken up the blood supply to the different route and the function has been reorganized. If the patient gets TPA after the ischemic stroke and the right medical intervention, the patient can speak within few hours and can have a complete reversible stroke symptoms from no speech, no walking, no talking to the word to phrase to sentence level only in few hours. But not all are lucky. So it depends on the lesion, localization, and also the person. No two person with same age, same stroke lesion are same in recovery. Even if at all they get right adequate intervention. So everybody is different, but only based on the scans, may not predict at all that it will have aphasia or dysarthria. We get to see patients who have left brain stroke and may not have significant aphasia, but a specific anomia. Just कुछ चीजें बात करने में दिक्कत है, बाकी सब कुछ अच्छा होता है. Possible हो सकता है, but some people can have real severe aphasic, apraxic, dysarthric output. So it is not just scans, but clinical correlation of how he or she is speaking, word level, phrase level, sentence level. And sometimes patient can speak, chai chahiye, nahi chahiye, reh jao, theek hai. But that is not just communication. So you have to ask the patient in the longer sentences also. So you don't miss. So have a simple screening protocol. I told you, simple, quick flashcards you can show. Ask the person to make a sentence. And that could be helpful. I hope I could give you answer to your question.
There's one question in the chat box. Mr. Sridhar is asking, can a session be arranged with typical characteristics of different types of aphasia? So
well, Sridharji, I'm trying to have a brigade of my students who are volunteers for my neuro rehab work. So we are on it. We will try our best to try to have some sessions for you. So post September, we will have alternate week some sessions. Aphasia Stroke Association of India, Stroke Support India, Neuro Rehabilitation Association, together we will work and see how we can help patients. But it's an individual session would help more because not every patient is same. Not all the exercise will really have the same application. So Guru, for you did a great job, Guru. I'm so happy. Thank you so much for volunteer work. Okay, so can you say this? Pa ba pa ba.
Ba 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 ba.
Pa ba pa.
Ba 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 ba.
Pa ba pa.
Ba 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 ba.
Papa, Babu.
Bo, bo, bo. Bo, bo.
Papa.
Papa.
Babu.
Babu.
Papa, babu.
Papa, babu.
Nice. Papa, babu.
Papa, babu. Papa, babu.
Babu, papa.
Papa, babu. Papa, babu.
उल्टा बोलना है अभी.
Baba, babu. Baba, babu.
Papa, babu.
Papa, babu. Papa,
पापा ने
babu.
कहा, बाबू जाओ, कुछ चॉकलेट लेके आओ.
Papa, mama, Reddit, Reddit, Motina.
ठीक है. पापा ने कहा,
पापा ने कहा,
पापा ने कहा. Say it word by word. पापा ने कहा. पापा ने कहा.
कहा, पापा ने कहा,
बाबू,
पापा,
बाबू अब सो जाओ.
पापा, तानी.
So try to have this per b as a simple exercises. Shruti is there? ठीक है, ठीक है, हम बाद में बात कर सकते हैं. पापा, बाबू, बाबा, पापा.
Papa, babu, papa.
This could be simple exercise for the per and b. Okay?
Papa.
अभी आएगा बोलने. पापा, बाबा.
Papa, babu. Papa, babu. Papa, babu.
Call your daughter.
Papa, papa. Mama, baba. Hi. Hi.
Hi girl. Thanks for being our warrior's help. Huh? I want you to do some exercises with your dad. Huh? You will do that na?
Okay.
करोगे ना?
Yes.
पापा, बाबू.
Papa, babu. Papa.
कभी धीरे धीरे बोलना है, फिर जल्दी जल्दी बोलना है. First you should go slow. Papa, babu. Word by word. Okay? So this is 1, 2, 3. Papa, babu.
Papa, babu. Papa, babu.
Papa, babu.
Papa, babu. Papa, babu. Papa, babu.
See, now you got it? कभी कभी बा ठीक से नहीं आ रहा है ना? Sometimes he is able to say, sometimes he is not. So this could be a task for improving the lip function. Integration of just lip. P, b, b, p. This could be starting. You can do this 3 to 4 times a day. Then have a, e, u, e, a. This can be done by anybody with some milder dysarthria, milder apraxia. It will benefit. Next, you can do t, d, d, t.
Ta, ta, ta.
T, d, d, t.
Ta, 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 ta. Ta,
Tata,
ta, ta.
tata,
Ta, ta.
tata,
Ta,
tatagaru,
ta, ta, taru. Ta, ta,
tata.
tata.
So both have different meaning. एक टाटा है, एक टाटा जी है, रतन टाटा जी. एक है ताता. So a और a, it has a meaning, it has importance in your words. So कोशिश करो ये प्रैक्टिस करने की. करोगे ना तुम प्लीज? हाँ, करवाओगे? Good girl. Okay, next is k, g, g, k.
Ka.
तुम बोलो.
What is it again?
K, G, G, K.
Ga, 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 ga.
K, G, G,
K, G, G, K.
Ga, 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 ga.
So this is the tongue movements are not rightly getting placed. So what would be better? Check the any word which he is able to utter correctly. On ka, kagaz,
Kagas.
carrot,
Red.
cabbage.
Bed.
See, there ka is coming rightly. But if I'm saying, then it is not coming. So you need to work on that. Okay? So this simple exercises can help you all.
Oh,
Okay? Guru, you have stayed for long. Hats off to you. Huh? Good courage. 2 hours.
okay.
And you are stroke warrior. You are encouraging many people. So you get better fast, improve fast, help many patients and help many people that they shouldn't develop this stroke. Okay?
Oh,
He's
And Shruti,
programming.
thanks for you.
He's
Your
programming, ma'am.
enthusiastic questions and work, huh?
He's programming right now. He's learned
Superb.
programming.
Great, great. Teach me also. I want to also learn some programming so that we can make some simpler apps.
okay. Sure.
Great. So let's meet on next webinar then. So this sir, can I take your leave?
Shruti, I had some quick questions. I'll just couple of questions. I know we are well past our time, but मैं सुन रहा था तो मैं थोड़े से
I tried making it more interactive, so actually I had to
no,
give
it was
time.
great. It was a great session, and I'm sure many takeaways there.
I would like to say thanks. I'll be off camera, but I have guests coming in. Thank you, Sonalji, for the wonderful session, but we still have a lot of questions. Hope to meet you again with all our group members and take benefit of your ocean of knowledge. That much I can say.
Indeed, indeed.
I'll try my best. It's really ocean to say. I tried helping people understand what it is and what it is not, and how we can work out with a simpler, basic level 1 or 0.5 exercises. So let's go ahead.
Ma'am, it was truly helpful. Ma'am, it was wonderful. It was truly helpful. And definitely when people talk to us, we can advocate more of therapy to them. That is what I do. I tell them, no, we'll do it by ourselves. Yes, even we are doing it by ourselves. But I maintain a journal. I write down each and every point the therapist says so that I can work with him. So, but I say that please look out for a therapist near you.
From a severe phase, moderate to milder, and from milder, very little residual or no deficit is what should be your aim. And changes of your pattern of therapy happens as the patient improves or regresses or maintains the same plateau. So right rehabilitation is very important. So get right help. Okay.
Yes. Ma'am, you told about the cards. It's available on the web. Can you please spell that, ma'am?
CNEQ cards.
CNEQ, Q for Queen, right, ma'am?
CUEQ cards for oromotor exercises.
Okay. Okay. Thank you, ma'am. Thank you. Hope to meet you once again. And I will definitely encourage all our group members to make best use of your advice and all the exercises that you taught today. Thank you so much, ma'am. And thank you for your wonderful patience as well. After your entire day of working, you have spent almost more than 2 hours with us. We are very grateful to you for that.
My pleasure.
Indeed. Thank you. I am just seeing Akansha has raised her hand. Akansha ji, you can quickly ask and then we can take it.
Yes. Hello, ma'am. That was a great and very insightful session. I just had a question. Can you give us some tips to work on the short-term memory, the memory part? That, you know, I am trying some drills and I'm trying some.
But you can try to work on short-term memory by giving list of words, familiar words, and see how he or she recalls. So list of 5 words. Then you can add one non-word like chai ki jagah pe hi, yeah, die or pi. If it is meaningful or non-meaningful, you can try that language you can say. So, pani, one can say mani. There's no meaning to the word. So you can have 4 words which are meaningful, 1 non-meaningful, and see how you can recall.
Because
Some
at times, you know what?
words spoken, some weaker words you can flash as a pictures. So visual memory. You can actually go to website and check constant therapy app or a parrot therapy, or there's a tactus therapy for cognition task. Wonderful, simple exercises are given. So that could be helpful for you. But I would request that if you have some difficulties with short-term memory in a patient, getting a right referral from a neuropsychologist and speech pathologist could really help you to improve that what is the cognitive level now and how do you improve short-term memory, because that's very important for any learning.
Like the speech is coming, but at times while speaking, he want to say something. He's come to a phase that he's now speaking in 3 to 4 words in a sentence, which is very great.
Yeah. So you are talking about word retrieval. So see, this memory and
he
word
forgets at
retrieval
times
go
what he
hand
was
in
about.
hand.
Okay.
Yeah, so short-term memory, importantly, when whatever is asked, if it is forgotten, then you don't get what was asked, and then you search for the words. You search for the instances that, okay, I don't know what
But
was asked.
you know what? This is very
happens.
occasional when it happens. Maybe when he's stressed or he's thinking something, is that the trigger? Why is it happening?
Possible.
It is not
One
happening
can get cognitive fatigue.
regularly.
Post-stroke, people have huge cognitive fatigue. They forget easily because they can't retain, they can't store, they can't even retrieve. So attention gets impaired, they can't process correctly, so then they cannot execute rightly. So storage is a memory from where you have to take the words out. Concept is one thing, but then to come to that level that what it is, people sometimes get so much fatigue that they don't come, and then the word is not rightly retrieved. Severe apraxia, severe aphasia, and the cognitive impairment can go hand in hand. There could be aphasia with poor cognition, and there could be aphasia with very good cognition in terms of non-verbal tasks. So it depends.
The long-term memory is great. The short-term memory is a problem.
So one has to understand that, yes, short-term memory, working memory, recent memory can get broken down post-stroke. That can be worked with some non-verbal tasks, some verbal tasks, some different tasks from the familiar, non-familiar, new words, different tasks. Hierarchy can be made.
Okay, ma'am.
So you have a patient with aphasia and apraxia. So
yeah, my husband
ask
had
your therapist,
global
how do I work on that?
With no cognition, no speech, nothing. Then he started with one word. He started saying papa, papa initially. Then I made him do the sounds and vowels and everything. Most of the things that you have explained, I did adapt that. So it has been a long journey. It has been
now what happens? We cannot say that there is no cognition. Sometimes non-verbally, with no talking and no listening task, they would do excellent with their old phone usage or laptop usage. Sometimes there would be disinterest, apathy. Sometimes they are having no drive that I want to communicate. Sometimes they feel ashamed of themselves. So to work on emotional also and then communication.
Affected, I have noticed, like he's very doubtful of whether he can come back to work ever. So now he's not even trying.
Rehab will be so helpful.
Yeah, but he's not trying to work on laptop or like that part.
I can understand as a caregiver what it must be for you. And you are pretty young. So in a younger age, all this could be really devastating. I know stroke can really have a very devastating effect on family. But you never lose hope. You try your best that he will make improvement step by step. Right? Rehabilitation is very important. So getting him to the point, yes, no commands, pictures, simple app, recall could be helpful.
Yes, ma'am. Thank you so much.
Thank you very much, Sonalji and everyone. I had just a few questions. Maybe if the way that I see it, as you rightly said, this is an ocean. There are so many factors, then there are some overlapping factors. Those factors will maybe change with time also. I just wanted to know, is an accurate diagnosis, क्या वो remotely हो सकता है? कि this is where this particular patient is presently, given that there could be a combination of so many things happening at any moment in time. So क्या remotely accurate diagnosis हो सकता है?
I'm sure you are aware of tele-stroke units, tele-rehabilitation. So tele-consultations are available. There are many specialists who try to do online consultation. They try to ask you that, do this task, record a video, send it. And with the right diagnosis, one can determine the line of treatment. So it is very much possible. We have many tele-services available now. So right referral is sought. And many times patients are not going to right professionals because they may not have the person in their vicinity. So accessibility is one big challenge we have. And if the patient and the clinician ratio, like see, I have seen some patients where if I have 12 to 15 referrals a day, I have to teach, I have to see patients, I have to help family members, I have to do other jobs. So it was the time I'm able to give to one patient who has difficulty in swallowing, understanding and talking, also speaking, thinking, reading, writing. So it is a person whole. That could be only one person who has only dysphagia, not able to swallow, versus someone who actually has only difficulty in getting correct words. In one language, he is much better. So these are the complexity of presentation in Indian scenario.
Right.
But tele-rehabilitation is a boon. And I'm a strong proponent of tele-rehabilitation, telemedicine, tele-stroke units. People can get connected. They can seek some help from other professionals. They can have those scheduled appointments, and patient can be even dealt well with the some simple modules, some avatar where patient can be initially assessed. Absolutely. What are the needs, and some simple modules can be started. That could be really important for India, and we're trying our best. Let's see how we can work on the stroke care, because not one person can help all the patients, and you have huge challenges in this.
That's right. So there are efforts in that direction with maybe language specific apps or something like that happening. Yes. Can
So some tasks for aphasia can be done even remotely. Some tasks require one-to-one rehabilitation. Some tasks can be done very nicely with 4 or 5 people in group, and they really can get some support from each other. Whereas dysarthria, it's more that person understands. He only have a poor execution, articulation, clarity. So muscle weakness needs a individualized session on that muscle power, symmetry, tonicity, exercises, rehearsal, based on that person. You can't help the person just one session, but there are patients who require improve in just one session also. So like how I was telling the guru that, see, Papa and Babu, initially he couldn't get, but third attempt he could get it. So there are simple tasks, but you have to try to work on that. So practicing rightly would be helpful, and then helping him to pace, think, and then get a word. Someone who is mother of two will not like someone speaking very fast and just moving faster. Someone has to have patience. So there are a lot of challenges, and they need to really get implicated.
No, there is, of course, as you rightly said, there's a scarcity of professionals also. Finding the right person to begin with is a challenge. So yes, these are the challenges, and also within that, hats off to everyone, like you, Joki, despite all those challenges, is trying to make a difference. That is. And also another question that I had was, in this, sometimes we hear about this augmentative devices. So where does one start?
Sorry, I missed talking about that. Rightly you have pointed, augmenting devices. So not all patient requires augmentation, that is use of devices. But if the person is at word level, I would like to augment him or her with some pictures cards, some app. So where he will make phrases. He can learn, and he can say 2-word to 3-word phrase with the simple app. if the person is at phrase level, he might want to hold conversation. So using right apps, making a sentence could be helpful. So you augment someone's communicative ability with picture cards, simple app, simple gesture. आ जाओ जल्दी. तो someone may not get correct words, but then he only has some gesture. So you are augmenting, you are adding, so that you still heighten your functions. So that's the augmentative. So you have a high tech and you have a low tech. So high techs are like those speech generating devices, the computer tabs and the high tech apps. Low tech is something like you have a simpler task where you just have an app which has a pictures to press and it will speak for you. No technology is where you have just gestures. Jao, ow. You teach the person some simple gestures, signs. A simple picture communication board, you can exchange with the pictures and communicate. So some assisting devices could be helpful. Whereas some people who can afford, and the people who are brainstem stroke, I told you last time, the person, like I remember Shri or someone in our group, he just still can't verbalize more than a vocalize, and he is at great typing level. So I tell you, for him, the STOBI gaze, it's called brain computer interface based, where the brain sends signals and are caught well by the computer that you want to choose this apple, not banana, milk and not coffee. I want this and I want that. So you can choose, make a sentence and it will speak for you. So you can have a speech generating device like Stephen Hawkins had a severe dysarthria, then anarthria, the no output later, but it was not a stroke. So you have some severe stroke patient, they may not execute muscle power rightly. So those can go for generating devices, SGD. So augmented devices can range with have a larger technology impediment. Thing is, we still have to go a long way because we don't have the language specific apps yet. Hindi, Marathi, Gujarati, those apps, and then people are not user friendly with the apps. And with the same speed, what pre-stroke someone could use the mobile laptop, even the techie I have seen unable to use the laptop phone so well. So because of the executive dysfunction, they are not able to do so well with the one hand, which is dominant hand, paralyzed. So left hand people have difficulties. So some people switch, use, reuse, learn. So those are the challenges we need to overcome.
You're right. And also, where does one draw, where does one draw the balance between, let's say, depending upon such a device versus trying to practice, on and trying to recover on one's own?
Good question. So, sir, I would say when there is an urge to communicate, you will always like to talk to naturally in speaking. So when you are helping the person listen, get the confirmation or information rightly, you will click, show the picture, point and all, but that will help you, that will build your communication inside, the competence, post-stroke. And then eventually when the weakness is less, the brain circuitries are building, reorganization, someone gets words. So there is no hard and fast rule that introducing the technology will hamper your speaking. That's a myth, that's a wrong notion. One should give picture communication at the bedside. Yeah, that word AC is not utilized by many clinicians, but that's very important. You have to give some means of communication.
Absolutely. And the other question that I had was, and I know that some of the people in our group and some people who have joined also, are there medications which can improve? For example, some people talk of an Ayurvedic medication, ashwagandha, for example. Are you seeing some such medication?
To my knowledge, I have seen so many my patients sometimes dropping my therapy and saying that, ma'am, हमको यहाँ पे दिक्कत है, ये पानी पीने से, ये करने से बात अच्छी आती है. And I have told them that no, ma'am, no, sir, no, भाई, ये नहीं होता है. बात करना एक behavior है. इसके लिए आपको exercise करनी पड़ेगी. गोली लेने से बात नहीं आती. Otherwise, I would not spend my 10 years plus in the stroke and neuro rehab, speech language, cognitive solving therapy. It is the exercise which will bring your work back. But some people like to experiment. They call it CAM. So alternative complementary medicine. So Ayurveda, yes, you can improve your agility, some attention, you can say somewhere they say they get to feel bit calmer side. There are some medication which can help, Shatavari, Brahmi and all they have seen. But I don't know how far the research in terms of aphasia and dysarthria, that only use of that is helping. No, there is no such study that taking ashwagandha, someone will speak clearly. I have seen people giving that, vaha, eaten by parrot and all. They say that you eat and someone will start speaking clearly. Or just doing massage on the tongue itself will give you words. No, it's a absolutely wrong notion that with only honey on the tongue and massage will bring the talking to you. You require a good speech language therapy, professionally, well planned, executed rightly, across the words in a communicative manner. When you have to get correct words, speak correctly, the place phonemes sounds well. So this is something what I can tell you and tell all the audience. Don't go behind this that okay, मेरे पास आ जाओ, मैं ये आपको दूंगा और आपकी बातें आ जाएंगी. No. Many times I've seen people having those centers. Some speech therapy is given, some reciting, music can be really boon. So music and reciting can add some help to the patient, but not just alone some medication. Okay, there are not much medication available in India that only medication will give us good clarity, praxis and speech and language. Okay, yes. Now you have objective evaluation and objective treatment for aphasia, where they say that okay, which part of brain is more damaged, where the pathways are hyper or hypo activated, which are giving perseveration or poor activation. So they do transcranial magnetic stimulation or direct cortical stimulation, and with that therapy, speech language sessions are given. No behavior intervention will not give any result. So with adjunct therapy and the objective neurobiological therapy together gives a better results. So no substitute of mine yet. So I can still go on working.
Right, absolutely. So as you said, therapy as well as...
Jokes apart, I give this take-home message to all of you here. Please help people with stroke. Help them communicate. Speak slowly. Don't consider them as deaf and dumb. Don't speak stupidly like a child you're talking to. If they are not able to speak clearly, you speak slowly.
Right.
Give them pacing. Help them condition. Give them some pictures, cards. Make sure that you continue your rehab. People feel that it's expensive. Sometimes they lose the faith in rehab because the patient is not improved in just 2 sessions. So it is not a miracle. You have to, some patients take time longer to improve. So it is a step-by-step techniques and rehabilitation process. So have patience and rehabilitation and try to consult right people, seek opinions. Don't do doctor shopping. I have seen people taking therapy from 3-4 people together and saying that किसने भी help नहीं किया, 3 session लिए कुछ भी नहीं हुआ. That's 1 or 2 sessions may not just help, but see that you have to have faith in therapy, faith in professional, and work at home. You have to practice. That's a key to improve speech abilities, intelligibility, communicative effectiveness. And it is communication, not always speaking only. Okay, thank you.
Correct indeed. Thank you very much, Sonal ji. It's been a great session. Aapne kafi time and efforts, and I'm sure even in the future, when we view the video again and others also view it, they will carry a lot of takeaways from here. And of course, looking forward, we all look forward to all your and all the professionals' continued support, in rehab efforts. And we are there, of course, looking forward to all your help. That's what I can say. So again, bahut shukriya. Thank you very much. Indeed, very nice session in almost 2.5 hours I'm seeing. So a lot of your efforts, Thank you. And I'm closing the meeting now and look forward to again catching up with everyone and you. Thank you. All the best.
Thank you, sir. Thank you, madam. Thank you. Bye.